Greetings, Green Warrior, and welcome back, Dr. Rogers.
Hi.
Green Warrior, have you ever wondered why most conventional doctors don't know much about nutrition, often prescribing medications and procedures without seeming to have the information on how to cure? Today, we'll dive into medical reformation, exploring why this gap exists in medical education and how a whole food plant-based lifestyle could bridge this crucial divide for better health outcomes. And Dr. Rogers is here to share a presentation with us. It's going to be mind-blowing. You basically rewrote the medical textbook.
I come across the conclusion that conventional medicine, the textbooks are all wrong. That's not an understatement. And I know that because I went through the medical literature, and the medical literature is not the same as the textbook, and they never get updated. And so I found out it's not just diabetes, it's all of the common internal medicine diseases and their fellowships and subspecialties.
Before you start your presentation, we're going to begin with our game of true or false.
It's time for True or False on Be Green with Amy Live. Answer true or false to Amy's questions in the comments below, and Amy will ask our guest for the expert answer.
Okay, let's start with this one, Green Warrior. Tell us what you think. True or false? Conventional medicine textbooks claim that chronic diseases are associated with aging and genetics. Do you think that that's true or false? And while you're typing in your guess, Dr. Rogers, what's the answer?
Yes, and that's why I think the conventional medicine textbooks are a joke, because they say this on almost every single chronic disease. Well, it's associated with aging, and it seems also to be partly genetic. And what they're doing is they're taking your power away from you. They're telling you, you can't change your age, you can't change your genetics. So they're basically saying, you are helpless. There's nothing you can do. Come to us, and we will give you a magic pill, and we might even give you a magic surgery. You're lucky we're around with all our pills and our surgeries, because you poor thing, there's nothing you can do for yourself. And that's bullshit. There's a ton of stuff you can do to help yourself. And almost all of these diseases, actually, once you go into the scientific literature, the epidemiology and toxicology as well, you can see there's a known cause, and you can actually dramatically improve your health by adjusting your diet and habits.
All right. The next question is, true or false? Most doctors are well informed and frequently read medical literature. What do you think, Warriors? Dr. Rogers?
Most doctors are functional illiterates, and there's a reason for that. It takes a long time to go down the medical school path. You got 4 years of pre-med, 4 years of med school. Typical, internal medicine residency is 3 years, but then really if you do a fellowship, it ends up being about 6 years for most internal medicine subspecialties. And what ends up happening is then a doctor typically goes into private practice. They join a group. They want to make partner. If you want to make partner, you get all the lousy shifts the first couple of years, let's say the first 5 years. So you're taking lots of weekend call, lots of night call. You've delayed having a family till you're done with residency. So now you want to have a family. You're up with the baby. And the point I'm saying is they're exhausted. The senior partners work them into the ground, the junior people. So years go by that they don't open a book other than like a quick pocketbook, let's say antibiotic dosage for a given infection. So they stop reading. And then, let's say it's a guy and his wife he comes home from work. She's like, you neglect me. You never take me anywhere. Okay, fine. We're going on vacation. The reason I say that is they'll go for a CME, let's say, to some nice warm state. They'll sign the attendance in the morning to get their credits, and then they just go to the beach all day. And the other thing is most of the lectures in CME, continuing medical education, you're required to do 50 units every year. It's run by the drug companies. And what do? They say, buy our drug. Okay, it's a big joke.
I've actually had the privilege of attending some of those CMEs. And other than the ones that I've attended that were associated with plant-based nutrition, I agree. That has been absolutely the case. Okay, true or false? The average endocrinologist has thoroughly read the basic papers on the causes of diabetes. Oh, let's cross our fingers and hope for a good answer. Dr. Rogers?
Yeah, so, I really wanted to understand diabetes. So I went and read through all the papers, watched all the relevant lectures on the internet, and really trying to understand it. And so then I talked to some internal medicine friends of mine. I said, who are the best internal medicine doctors in the area where I live? Big city, university hospitals. And I found their names. I called them and I met with a couple of them. And so I said to them, what do you think of the Sweeney paper? They go, I haven't read that. I go, what do you think of the Hemsworth paper, the Rabinowitz paper, the Shellman paper, the Brownlee paper, the Taylor paper? They're like, oh, haven't read it. They didn't read a single one of them. I'm like, How could these guys be treating diabetes when they haven't read any of the basic papers on the subject? And I know why. They are experts on all the drugs. You've given them your insulin dosage, your age, your body weight, your comorbidities. They'll give you the exactly correct drug, but they don't know anything about the disease. And that was like the old joke, the American Diabetic Association diet was a good one for keeping people fat and sick and diabetic, okay? They don't know the pathophysiology of disease. And the relevance is that for any disease, you want to know what causes it, because very often what causes it, by avoiding that thing, you can cure the disease or at least slow down its progression. That's basic, okay? But medicine ignores that. The three most important topics in helping a person be healthy are nutrition, epidemiology, and toxicology. None of those subjects are covered in pre-med or in med school or residency. So doctors don't know those things. The three most important things. That's why a health coach who studies this stuff can get better results than a doctor.
Wow. Okay. True or false, Green Warriors? Most American healthcare providers understand that diabetes is primarily caused by high-fat diets. Dr. Rogers?
No, they don't know nutrition at all. And they get a false sense that they know nutrition because they're told, oh, nutrition is just combined with biochemistry. And biochemistry is like the most difficult subject in med school, but they don't learn nutrition. They learn a few things about cholesterol, and that's about it. And they come out of there thinking they know nutrition. I thought I knew nutrition. I was a great student in biochemistry. But I got fat in my early to mid-30s, and I'm like, how did this happen? And it wasn't until I realized that I'm screwing up, I couldn't lose the weight for 3 years, that I went back and started to really study nutrition in a serious way, and I started to understand things a lot better. But they don't know nutrition at all. And as a matter of fact, if you go to any medical meeting, I actually went to one recently in a real famous hospital, I'm not going to say the name, they typically say very stupid things like, oh, the Mediterranean diet. The Mediterranean diet is a bunch of nonsense. It's what people say when they don't know what they're talking about, and they want to pretend they know what they're talking about. It almost doesn't forbid anything. It allows alcohol. It allows cheese, dairy, meat, olive oil, canola oil. It's fish. It's full of high fat foods. It's stupid. I mean, it's like I said, it's a fake diet, so to speak.
Yes, with an exotic name. True or false, Green Warrior? Most surgeons are well trained in improving blood flow to wounds. Dr. Rogers?
It's rather remarkable, but typical surgeons don't know anything about blood flow. It's rather shocking, in fact, because you could really improve healing. And there are such a thing as healing clinics. I did an open surgery, general surgery internship. Okay, it was really a transitional surgery with the emphasis on general surgery, vascular surgery. So I spent tons of time checking patients' ankle brachial indices and whatnot. And we never learned any of this stuff. And I go back now and I talk to the different surgeons, including surgeons related to fields with vascular disease. They don't know this stuff. They don't know what a zeta potential is. They don't know that atherosclerosis is a blood clot. I learned all this stuff by reading on my own. I had done a fellowship at Harvard with the emphasis on vascular disease, but I didn't learn any of this. And I used to think that vascular interventionalists, that's what I was, cardiologists, cardiac surgeons, vascular surgeons, they are the experts of atherosclerosis. That's what I thought. But I learned something. No. They are plumbers, in the sense that they look at a blood vessel. Okay, so let's imagine this is an artery, and they say, oh, is there a blockage right here? How can we bypass that? We can put a graft across it. We can come across there with an angioplasty balloon and stent it open. But the people who really know atherosclerosis are the pathologists, because the pathologist just wants to understand. If you're a cardiologist, you can't say anything bad about stents, or they'll boot you out of the business. Okay, if you're a surgeon, you can't say a bypass graft doesn't work so well. They'll boot you out of the business. So they have, it's the pathologist who has no dog in the fight. They just want to understand it. They look at our microscope. They go, atherosclerosis, it's a blood clot. Once you understand that atherosclerosis is a blood clot, then everything else becomes so much easier to understand. And the vascular surgeons, the surgeons, let's say they're doing general surgery or something to heal a wound, they never learn any of this stuff. Atherosclerosis is a blood clot. You have to understand zeta potential. You have to understand what bridging molecules are if you want to increase blood flow. It's not that complicated. You want to minimize dietary fat, you want to minimize dietary sodium, increase potassium, magnesium, dietary fiber, and you'll have better blood flow. It's not rocket science, but they don't know that, as simple as that is, and a lot of wounds don't heal because they don't know that.
Wow. True or false? Medical education typically includes extensive training in nutrition. Green Warriors, type in your answer. Dr. Rogers.
Medical education is a joke, okay? I'll have medical students occasionally tag along with me. It's called shadowing, okay? And I always tell them right as soon as I see them, I say, I'm the doctor your parents told you not to talk to. I said, you're going to learn more in 1 or 2 hours hanging around with me than you've learned in the last 8 years. And they kind of give me a polite smile like, oh, yeah, right, you're full of crap. And then by the end of hanging around with me for an hour or two, they're like, oh, I got a couple say, well, I want a refund from my medical school. Because the truth is they haven't learned almost anything useful. Anybody, just go up. Anybody knows a medical student. You got one in your family. Start asking them some questions. What causes coronary artery disease? What causes atherosclerosis? What causes breast cancer? What causes diabetes? What causes autoimmune disease? What causes hypertension? They won't know the answer to any of those questions. None of them. Okay. And then the question is, well, why? Don't they study a lot? Aren't they smart? And I'll tell you, it's because their whole education's fake. And you go, what am I talking about? I'll tell you exactly what I just said. It's all fake. For example, I'm a triple boarded high-tech doctor, right? The most advanced mathematics that I ever used, I knew by 4th grade. Math is irrelevant, okay? All this mathematics, people study algebra, trigonometry, then statistics and calculus. It's irrelevant to being a doctor. It really is, and it wastes all their time. In college or pre-med, they have to do all math all the way through physics and calculus. They take, a full year of physics. What do they need physics for? I don't use any physics. I'm a high-tech doctor, okay? You don't need it. The other thing is they do organic chemistry for a full year. You could get by with about 2 weeks of organic chemistry, which is the relevant molecules to life. You don't need to know 100 different ways to synthesize paint, all right? That's what it is. So what I'm trying to say is they waste all their time on this irrelevant stuff as pre-meds. And then they waste all this time in med school. They'll memorize 15 different symptoms of lupus, but they won't know what causes it. It's totally stupid, okay? So I can say that, quite frankly, that a health coach who knows nutrition can cure more patients easily of the chronic diseases can the head of Harvard Hospital. It's a little bit reminds me of Martin Luther. Martin Luther says, a peasant with the Bible knows more than the Pope and the councils without scripture. And so nutrition, epidemiology, toxicology are where it's at. If you want to cure diabetes, hypertension, coronary artery disease, because these are all dietary diseases. So you have to understand diet, and that's just what it comes down to.
Yeah, it can be so frustrating. I was a patient advocate for someone who was being released from a surgery, and the surgeon said, make sure you get a lot of protein. And so I asked the surgeon, well, how much protein would that be? And he said, lots. So, and then he offered a case of a protein drink. I won't say the name of it, but everybody is sure to know what it is. And said, this will have a lot of protein for you. So that was the nutrition. And apparently he was provided, that company provided those samples to him.
Yeah, and so the way I would phrase that is, the important thing is that you be low fat so you have good blood supply to the wound. Be low sodium so you have good blood supply to the wound. When a wound is healing, it actually does need more protein in that phase of acute healing of a large wound, because you need biosynthesis to recreate the wound. But the problem is, if you service it in the form of a high-fat drink, which I know which drink you're talking about, then you're going to be impairing blood flow. Okay, so that's not what you want. You can get protein without high fat. Lentils as a bean, they're about 30% calories from fat, and they're only 3% of the calories. 30% of the calories from protein, but they're only 3% of the calories from fat. So that's what I would think would be good. You got good blood flow, and you still get, or whatever else you need.
Yeah, this was someone who was just being released from having a bypass. So yeah, it wasn't pretty. Okay, let's go with the next one. Green Warrior, what do you think? True or false? Conventional medicine often cures chronic diseases such as hypertension, diabetes, and autoimmune diseases. Type in your answer, and Dr. Rogers.
Yeah, so what I would say about that is they never cure these diseases, ever. Cure rate is 0. And that's why I think conventional medicine, as far as internal medicine and these common chronic diseases, is a joke. Imagine you had a sports team, and the sports team lost every game, 100 out of 100 games. They always lose, and they walk around saying, we're the best, we're for real. Okay, and those stupid health coaches, they don't know anything. We're the best, we're the best students, we're the real thing, we're allopathic medicine, we're the best. The reality is they never cure anybody. I'm not joking. What do? They match the pill to the ill, and they send a bill. How long do you take that pill? For the rest of your life. For hypertension, for diabetes, for autoimmune disease. Okay? You got a low-fat vegan diet, you'll often, and with low sodium, you'll often cure hypertension. Okay? Walter Kempner had patients in the 200s who he got back down to normal. All right, the more chronic it is, the more the arteries are calcified and damaged, the harder it'll be to return it down to normal. But very often, early on, it's pretty routine, like 90+%. Okay, diabetes. Roy Taylor showed that if the patients lost 30 or more pounds of weight, all of those patients who did that, they all cured their diabetes type 2. Again, you got to get to it before the pancreas is burnt out, so to speak, and loses the islet cells of the beta cells to produce insulin. But you routinely cure it. And autoimmune disease, if you restore the gut, so you no longer have leaky gut, increased intestinal permeability, you very often can cure it. Internal medicine, basically, and the internal medicine subspecialties, their philosophy is, man, it's yielded a pill, send a bill. And if you cure a patient, imagine you were to cure a patient by accident, you lose the customer. They don't come back. So they don't want to cure the patient. It's not in their interest to cure the patient. They want that patient sick forever. And in a sense, every day they got to pay money for medications. They got to come back for follow-ups, possible complications in labs. And I'm joking, they milk them like a cow. They turn them into a chump and milk them like a cow every day the rest of their life.
All right, Green Warrior, let's try this one. True or false? There are reliable tests to diagnose Alzheimer's disease. Type in your answer. And Dr. Rogers.
Alzheimer's disease is typical BS of conventional medicine. They basically promote this idea of the beta amyloid theory of Alzheimer's disease. And what it is, it's a way to say, no one really understands it. Your best chance is take our pill, okay? But I'll tell you why I think it's a joke, and I don't even use the word Alzheimer's typically, but I know they'll tell you it's the most common cause of dementia. All the doctors are taught that. And here's what I would say. Oh, really? How do you diagnose it? What's the historical question you can ask the patient? There is none. What's the physical exam finding? Examine them, put a stethoscope on them, test their neurologic exam. There is no diagnostic finding. And then the next thing you can ask them is, well, how about imaging? I'm a neuroradiologist as well. I look at their brains all the time. I've seen thousands of them. They'll say, oh, the characteristic pattern is, parietal temporal, medial temporal lobe atrophy out of proportion to the other parts of the brain. I hardly ever see that, okay? What about nuclear medicine scan? It can hint you a little bit in the direction. Some patients have more beta amyloid than others, but it's not reliable to confidently diagnose it. What about autopsy? Of course they can diagnose it at autopsy, right? Pathognomonic extracellular senile plaques, intracellular neurofibrillary tangles. No, lots of people who don't have dementia have those, and lots of people who have dementia who they thought had Alzheimer's don't have that at diagnosis. So there was a Notre Dame nun study, Moncano, Minnesota. They said, well, the nuns, some of the lady nuns were very academic. They liked to write letters. They liked to teach. And even though they had lots of the classic findings of Alzheimer's but weren't demented at death at autopsy, it's because they had more cognitive reserve. So they could tolerate more damage to the brain before becoming symptomatically demented. And what I'm saying is that's sort of, what do you call, an ex post facto, if you will, rationalization to try to keep the theory, because the theory is bogus, okay? And so what I'm trying to say is the whole field of dementia medicine is based on a bogus theory that they can't diagnose it and they don't have a treatment for. All the drugs just make people sick. They don't help them. So what I'm saying is it's a joke. And there are good theories of dementia. The best theories are, number one, the Jack Delatorre theory. Call it the vascular hypothesis of dementia. That's very good. That's the guy who tied off the carotids in mice. Number two is my theory. Peter Rogers, MD, neurovascular uncoupling theory, which is basically a great expansion of the calcium hypothesis. Number three is the Tetsumori Yamashima Calpain-Cathepsin theory of the toxicity of omega-6 cooking oils. Those are the best ones. And it's multifactorial. Often a person has multiple things going on simultaneously, but those three are great because they tell you what to do. Avoid omega-6 cooking oils, avoid atherosclerosis, and then I go into how you avoid all the excitotoxins, mitochondria inhibitors, SERC inhibitors, and all that stuff.
Okay, well, thank you for that. Green Warrior, true or false, eating a diet high in fiber can reduce the risk of developing diverticulosis? Type in your answer, Dr. Rogers.
Yeah, because it's abdominal pressure syndrome, basically straining at the stool with defecation. You increase intra-abdominal pressure, and then that back pressure is transmitted to your sigmoid colon, and it'll cause outpouching of the wall, little weak spots between the muscular layers. And I have a friend who's a radiologist from a country where they eat lots of fiber. He goes, in my country, we don't have any diverticulosis. We eat lots of fiber. and I can tell you, I you see it in the vast majority of patients over 50 in the United States. So it's.
Yes. It's amazing how many diseases that you would probably see in patients over 50 without even looking at their chart. You would know. Is that right?
Yeah. If you told me a patient's over 50, I would just assume they have diverticulosis. I wouldn't.
Wow. Okay. Let's see. The next one, true or false. High-fat diets, especially those high in cholesterol, can lead to the formation of gallstones. Green Warriors, type in your guess. Dr. Rogers?
Yes, gallstones, like about 95% of them are just precipitation of cholesterol in the gallbladder, because gallbladder is more liquid, aqueous-like than people think. People think all gallbladder is fat for absorption of fats, but no, it's actually rather liquid-like. It's partly fat. So anyways, yeah, high-fat diets predispose to that. And the reason that's relevant is because there's this big movement on the internet to try to trick people into eating high-fat diets. Okay, like I would say the first step in being intelligent is to realize that no one cares about you. All right, that's an important thing to get, because most people seem to think, well, this institution is looking out for us, this regulatory agency is looking out for us, the American Medical Association is looking out for us. No, no one cares about you. I could assure you, you patients, you people, you pros, you peasants, you are irrelevant. No one cares about you. You need to know that, because if you trust the system, you will get screwed over by it. I can guarantee that. If you don't trust the system and you are skeptical and you think and you read, you can navigate it reasonably well, because it is good at some things. It's very good at acute care and some chronic things. But if you just walk in expecting that they're going to act in your best interest, you're a chump.
Okay, true or false? Exercise can boost the immune system by facilitating the movement of white blood cells in the body. Dr. Rogers?
Yeah, your lymphatic system, your arteries and veins are connected to the heart. Blood pumps, the heart pumps blood into the arteries, and it travels around your body, returns through the veins. Okay, but the lymphatics run parallel to all your blood vessels, and they don't have a heart. They're not connected to the heart. So the way you get the lymphatics moving is you exercise. You move your muscles like a muscle pump, and that's relevant because it gets your those are your immune system cells. They're the ones that remove cancer. They're the ones that remove infections, and they sort of clean up cellular debris. And you want that happening to stay young and fit. So yeah, exercise is really important. It's also real important for your brain for other reasons. We won't get into that right now, but exercise. We're made to exercise. Think about your ancestors. They ran around all day. There's not a lot of places to sit outside.
Not without getting into danger or trouble or something. Okay. True or false? High-fat diets can cause red blood cells to stick together, making blood thicker and increasing blood pressure. Dr. Rogers?
Yes. Basically, high fat causes the red blood cells to stick together. Red blood cells have a negative charge on their outer surface. And imagine these are two red blood cells. I'll make them blue because that's just what I got. And then this marker, imagine this marker is LDL cholesterol. It overcomes the zeta potential and sticks them together. And so the LDL cholesterol is called a bridging molecule. It causes blood to be more predisposed to clotting. That's why it's atherogenic, as does uric acid, as does fibrinogen, so as does LPS and LTA, bacterial endotoxin. So those are bridging molecules. They stick red blood cells together. And so the reason you have a blood pressure is to get blood to the top of your brain against gravity. It has to pump. So, if you're pumping water, you can do that with relatively low pressure. You start pumping thick blood like a milkshake, you got to pump a higher pressure to get it up to the top of your brain.
Yes. So speaking of blood pressure, true or false, high blood pressure can damage brain arteries, potentially leading to atherosclerosis and cognitive impairment. Dr. Rogers?
Yeah, basically what you want with blood pressure is Goldilocks, the golden mean of Aristotle, to stay in the middle. And so what am I saying? If you're hypertensive because you're eating high-fat diets with high sodium, put your pressure too high. And the high pressure will damage the arteries of your brain. Every time you have a bifurcation, let's say this is a bifurcation, the blood hits against the bifurcation point, and it'll start to injure the blood vessel, and it'll respond by thickening its wall and forming clots. And so you don't want the pressure to be too high. That causes atherosclerosis. The number one risk factor for strokes in the brain, silent strokes in the brain, is hypertension. All right, so you say, well, I'm going to treat my hypertension. I don't want that. But remember, why was the pressure high in the first place? Because you have to get blood to the top of the brain. So you have to be careful about not taking too strong of a medicine, because if you take too strong of a medicine, lower the pressure too low rapidly, now you're not getting enough blood to the brain. You're going to get hypoperfusion stroke. So you're damned either way. So the smart move is, like I said, the smart move is trust God's way, okay? He made us to eat these plant foods, to run around outside. And if you eat low-fat, plant-based diets, which is a species-specific diet, you'll have a good blood pressure, all right? And you don't have to mess around with these medications. That's the smart thing to do. That's how you win the game.
Yep, you earn it. Okay. And we have one more true or false. And then, Green Warrior, we're going to dive deep into this information with a wonderful presentation. So the last true or false question is, true or false, the average person should have 2 to 3 bowel movements per day. Dr. Rogers?
Yeah, that's normal for somebody eating a plant-based diet. And you'll have a few more on your day off because you're relaxed, lower stress level. You'll have more parasympathetic autonomic nervous system PANS. On a busy, stressed out day, you might only have 2. So the more stressed you are, the more you sort of you get more sympathetic autonomic. I call that SAN, sympathetic autonomic nervous system versus PANS, parasympathetic autonomic nervous system. So that would be normal. And they should be closer to being like cow patties. Typical SAD diet eaters, standard American diet with a lack of fiber, they're pooping out Tootsie Rolls and goat pellets rather than more cow patty like.
Exactly. And the evacuation should be pretty quick too.
Yeah, it almost comes out on its own. You don't have to do much. It doesn't require an athletic effort.
Exactly. Okay. Well, Green Warrior, Dr. Rogers has prepared a wonderful presentation for us to dive deeper into this topic. And while he's getting that ready, if you have a question for Dr. Rogers, please post it in the comments, and then we will be asking him after the presentation. I think I just saw it, and then
You want me to go back to it? I can go to it.
Yeah, and then this way it'll be ready to go.
Okay, here we are. We're ready.
Okay.
Should I start?
Yes, please do.
Okay, this talk is called the Medical Reformation, and I'm only going over medical reformation. I'm not going to go so much specifically on abdomen disease. I'm going to go through a whole bunch of stuff. So it starts out with this. Here's a picture of a happy, healthy monkey. And here we go. As the Lord spoke to the people in parables, let us now share the story of the zookeeper. Once upon a time, the zookeeper for the herbivore monkeys went on vacation. A medical doctor, MD, agreed to moonlight at the zoo. He figured his experience with talking primates would serve him well. Unbeknownst to the doctor, the new commissary intern had been feeding the monkeys the same diet as the jaguars. This is known as the jagoff diet. The herbivore monkeys got sick, and they were too tired to climb the plastic trees in their cage. Paradoxically, the female monkeys seemed happier because the male monkeys were no longer trying to mount them. The MD gave them pill after pill, which slowed things down a bit, but the monkeys kept getting sicker. It took 2 pills to control the monkey's high cholesterol and 3 pills to control the monkey's hypertension. The MD also ordered an endocrine consult for the monkey's worsening diabetes. Perhaps a continuous glucose monitor, CGM, with an insulin pump, some artificial intelligence, auto-programmable insulin dosing might help. The MD also wisely consulted the cardiac surgeon to evaluate the monkeys for open heart surgery, for coronary artery bypass graft surgery, CABG, CABG. The surgeon went through the standard consent for CABG with the monkeys: graft occlusion, myocardial infarction, heart attack, chronic arrhythmia, atrial fibrillation, permanent pacemaker, kidney failure, cognitive impairment, stroke, death, painful death. The monkey was scheduled for the operating room the next day. That morning, the zookeeper returned from vacation. The operation was postponed. The zookeeper put the monkeys on a plant-based diet. The monkeys came off all their pills and made a full recovery. However, the male monkeys started again trying to mount the female monkeys. One of the female monkeys filed a complaint that the zookeeper was a misogynist. The zookeeper got fired. Then all the monkeys died. Okay, this painting here is The Creation of Adam by Michelangelo, and this is the most important painting ever made in the history of mankind. And what it basically says is that man, being created in the image of God, is thus part divine, as well, of course, as part beast. And the relevance is that return to this mindset is the only thing that can save healthcare. No medical, surgical, bullshitology, and high-tech thing is going to make any difference, I can assure you. And the reason is simple. If you love the individual and place him as the highest priority to do right by that patient, you will do the right thing regardless of the money involved. And that's very important because there's a ton more money to be made by putting patient on pills that don't work or doing unnecessary surgery. You look at open heart surgery, the billing for the hospital is about $150,000. The billing for a coronary stent's about $30,000. What do you get paid for teaching them the vegan diet? $1,000 at the most if you're lucky. Bring them in for an all-day seminar, maybe 2-day seminar, $2,000. It's not much money. So what I'm saying is you have to love the person and believe that they're something special. The current system is based on what I would call atheistic Darwinism, which says that mankind is just a talking primate, a talking monkey with no intrinsic value or worth, and there's no real obligation to him. Okay? This is just a picture from the Bible. This is from the beginning of the book, where I say, you know, behold, I've given you every plant yielding seed which is upon the face of the earth, and every tree which has fruit, and it shall be food for you. So the original diet designated for humans from Genesis chapter 1, verse 29, is to eat a plant-based diet. After the flood, all the plants were wiped out, and they were allowed to eat meat. And it's a long story, but then there's the whole Daniel thing, which promoted a vegan diet. We're not going to get into all that now, but the species-specific diet is to eat a plant-based diet. All right. And now here is Martin Luther before the Diet of Worms. This is the beginning of the Protestant Reformation, and he had to go before Charles V, the emperor, who told him, you must recant. And Martin Luther said a few things. He said, I do not accept the authority of popes and councils, doctors and hospitals, for they have contradicted each other. My conscience is captive to the word of God. I cannot and will not recant anything. For to go against conscience is neither right nor safe. Here I stand. I can do no other. So help me God. Amen. And what I'm saying is, who do you think? A vegan health coach who knows nutrition, or an Ivy League, head of Harvard even, internal medicine, can cure more patients of chronic disease? And it's obvious, the person who knows nutrition. And it helps if you know epidemiology and toxicology as well. So here's the front cover of the book. Here's the back cover of the book. And it says here, best medical book ever written. And it's true, because it tells the truth about disease, including nutrition, epidemiology, and toxicology. Okay, and what I'm saying is what's happening right now on the internet with nutrition reminds me of the Renaissance. Basically, in the Renaissance, the best artists were competing with each other to try to make the best paintings. And, you know, a big part of it was to educate the illiterate peasants that they could learn the Christian story, if you will. But we're also, now it is to educate people to learn nutrition, epidemiology, and toxicology. And so there's a lot of wonderful opportunities to learn for free on the internet. You could cure yourself of coronary artery disease pretty easily for free with a low-fat, low-sodium diet and no oil. And you'll come out of it a lot happier than you will for open heart surgery. We're going to talk about that later, but true in a big way. Okay, conventional medical textbooks are typically all out of date, you know, anywhere from 50 to 100 years. And that's because, you know, you ask an old professor to write a new edition of a textbook. He's too busy. He doesn't get paid more or promoted based on the textbook. He'll just tell his junior fellow to write it. The junior fellow is just going to go by whatever the old textbook said, and it never includes nutrition, epidemiology, or toxicology. Okay, and so what I'm saying is they always write all the common diseases are idiopathic, meaning of unknown cause, and what it really means is the doctor's an idiot and the patient is pathetic. That's the Tower of Babel painting by Bruegel. Okay, and like I said, you turn the patient into a chump and you milk them for money every day when they got to pay for their medicines that they take every day for the rest of their life. The painting is made Milking a Cow by Gerhard ter Borch. Okay, so here's what starches are all about. They're low caloric density, meaning they stretch the stomach with relatively few calories. That provides early satisfaction of hunger, early satiety. And then the starch passes into the intestinal tract. The enzymes have to peel the fiber off before the glucose can be absorbed into the blood. And it's a very gradual process. It has the effect like of making the food into a slow release energy pill, if you will. Okay, so with the starch, you get a relatively little spike in blood glucose, and it stays elevated. You keep on gradually absorbing glucose into the bloodstream, so you get prolonged satisfaction of hunger with the fewest number of calories. Good early satisfaction of hunger, good delayed satisfaction of hunger. And these are your starches. They're just plant food. Starch means a polymer of glucose wrapped in fiber. Polymer means a bunch of the same thing connected to itself. Okay, so potatoes, sweet potatoes, rice, quinoa, oatmeal, beans, lentils, peas, garbanzos. You want to be skinny. The lower the percentage of calories from fat, the skinnier you get. Potatoes, sweet potatoes, white rice, they all got 1% of the calories from fat. That'll make you skinny. The lowest fat bean is lentils, about 3% of the calories from fat. Okay. And to eat starches, that's like the most, I've been a doctor over 30 years. You know, the most important thing I ever learned in all my years of training is that humans should eat more starch. Okay. And I also think fruits are pretty good. Fruits are better than people think they are. But fruits are a little bit of a pain in the butt because they're kind of expensive. They're kind of seasonal in their availability. They don't store so well. And the latest thing is they're trying to put some coating on some of them. The AP, letter E, letter EL. Okay, so that's a problem, especially with avocados and apples. So one needs to be careful to avoid that. That's a topic for another day, but be aware of it because I wouldn't eat that stuff. Okay, so basically here you are at the map, and the map showing the voyage of your life. What the typical chump does is they keep eating the SAD diet, standard American diet, full of meat, oil, processed food. They get fatter and sicker. They don't know why. They go to a doctor who doesn't know why either, puts them on a bunch of drugs. The drugs don't work so well. Then they start going for surgery. Chop, chop, chop. Bye-bye money. Cognitive impairment prematurely, dead prematurely. That's the life of the typical chump. Okay, what does a smart person do? They go, oh, gee, all my friends are getting sick. I better figure out what's going on. So they move to eating a vegan diet, avoid the toxins and processed food and whatnot, and they'll keep the Johnson working a lot longer. Don't have to take pills. I'm 60, by the way. I don't take any pills. I'm strong. I can concentrate 12 hours in a row pretty easy. I never had surgery in my life. I don't intend to ever have. Actually, I one time had an ear drain, cauliflower ear as a wrestler, but that's it. Okay, and if you do that, you probably die around 90 years of age, and you might just die in your sleep and not even have any major diseases. That's a good way to go. Here's a little more information on it. I'll sometimes call this God's way of healing. If you kind of do what we're supposed to do, like live like Adam and Eve, but keep your indoor heating and plumbing, it's free. You got to buy food anyways, and it usually works pretty well. Sometimes people get a bad disease and it's bad luck, and you can get infections and trauma and all that stuff too. But in general, this is just smart. Get your sunshine for vitamin D, get your exercise, keep that lymphatic system going. It helps the brain too. Get your sleep, manage your stress, maintain some good social connections. Religious people are much healthier too. They never talk about that because the current system pushes atheistic Darwinism, but religious people are a lot healthier. So enjoy the things related to that. Okay, any of the major religions, they've all been shown to dramatically improve health. Okay, man's way is expensive. It's painful, and it seldom works, okay? I'll choose this way based on a deep understanding of the system. Okay, now here's what this reminds me of. It reminds me of Dante's Divine Comedy, the great epic of the Middle Ages, where Dante says, in middle age, I found myself in a dark wood, and the path was lost. And that's like so many of us. We're pretty healthy through our 20s, and all of a sudden, we're middle-aged, we're working, we're commuting to work, we're up late at night home with the baby, and we get fat and sick. Okay, and so then you go to conventional medicine. Remember what it says on the sign as you walk to the inferno, to hell. This is Dante walking with Virgil, the great Roman poet who wrote the Aeneid. And on top of the gates of hell, it says, abandon hope, all ye who enter. Conventional medicine tells the patients, if they bother to listen, we cannot cure you. We never cure anyone of chronic disease. Never. Our cure rate is 0. We're the best. We always lose. We're the best. We always lose. Ridiculous. Okay. So Martin Luther was annoyed about a couple things. In 1517, on the door of the Wittenberg Church, he nailed his 95 theses, things that he thought needed to be discussed. Okay? And so I just made 25 of them. And the name of this book is The Medical Reformation. Number 1, why do internists treat atherosclerosis with pills which have a 0%, that's 0% cure rate, when a low-fat vegan diet with no oils, the Esselstyn diet, has a 99% cure rate? He had 198 patients, Journal of Family Practice, July 2014, and 99.4% had no recurrent coronary events in that 4-year observation period. And he says the one who didn't follow the diet. So it probably is even closer to 100% success rate for treatment of atherosclerosis. Okay, so number 2, why do cardiologists treat coronary artery disease with stents, which have a 0% cure rate, other than, during the middle of an acute heart attack, they can do something very useful and open up the coronary. But most of the patients just have chronic angina, okay? When, again, you've got the Esselstyn diet better than 99%, okay? Same thing with cabbage. Most cardiologists, cardiac surgeons, they don't even know that atherosclerosis is a blood clot. They don't know what the zeta potential is. They don't know hemorrheology. They don't know atherothrombosis theory. That's the most important thing to know. And what I'm saying is, this is like a basketball player not knowing how to dribble. It's ridiculous. It's like a baseball player not knowing how to pitch and catch. It's like, how could you have forgotten to learn the most important thing in your field? Okay. I wrote a story here about 2 patients with heart disease. Okay, the first one is Mr. AFC, and that means average frustrated chump, and that comes from like the PUA literature. PUA literature is the pickup artist literature, okay? It's kind of funny, okay? Average frustrated chump, the AFC. He's got typical cardiac angina, chest dyspnea, chest tightness, and dyspnea on exertion. He's proud of his carnivore diet. He says he eats meat like a lion does. He thinks his beer belly is just a joke, even though really it's fat and he looks like a pregnant female. Okay, he thinks his boobs, man boobs, are a joke. Actually, it's gynecomastia and as well as fat, female breast development in a man. His Johnson ain't working so well, and his wife is making fun of him. He goes to the cardiologist, who sends him for a stress test. This has been described by Dr. McDougall as a conveyor belt to the operating room. He has a cardiac cath, and they place a stent for $30,000. And then the cardiologist tells him, "You've got a widowmaker type lesion. We got to get you to open heart surgery." So he's recommended for a cabbage. Post-op, they run his blood pressure really low because they want to prevent bleeding at the anastomoses. My father had this. I couldn't talk him out of it years ago. By the way, I'm not talking about my father as this patient here, but I'm just saying is I stayed with my father in the surgical ICU after his surgery, and they ran his blood pressure so low it freaked me out, like 90/60. My dad came out of it fine, but he was a physician, real healthy guy who would run 10K races and stuff. Much healthier than the average patient. He shouldn't even have had the cabbage, but that's another story. I didn't know enough back then. It was many years, 25 years ago or something. I didn't know enough to talk him out of it at that time. Now I do. Okay, so this our stereotypical patient, though, a little bit of a bad outcome here. He had trouble coming off the ventilator, so they had a prolonged intubation. So they had to do a tracheostomy. So he's got a tube in his neck to breathe through. He had a small stroke. He wasn't able to eat safely for a while. They were afraid he was going to aspirate his food, so they put in a G-tube, gastrostomy tube, a stomach feeding tube. They're keeping the epicardial pacemaker wires on him just in case. His sternotomy site got infected, osteomyelitis, infection of the bone, so they threw in a PICC line. That should be spelled P-I-C-C for PICC line, peripherally inserted central catheter. I put in thousands of them. Okay, a PICC line for antibiotics. He's basically a MOF, which means multi-organ failure, congestive heart failure, acute respiratory failure. You could also use that for acute renal failure, respiratory failure, brain failure too. Cognitive impairment is very common. They call it pump head. It's so common. Okay, and then he saw the Dr. McDougall's lecture saying stents and cabbage have 0% increase in prevention, future MI, or increase in longevity. So he's a little bit pissed off. Okay, now here's patient number 2, a wise person who has cardiac angina. He knows he effed up because he used to eat the SAD diet. He accepts the fact it's his own fault. An intelligent person wants the problem blamed on themselves to be their fault, because if it's your fault, that quite often means you caused it. You could change it. Okay, if you're told some BS, it's just genetic, that means you're helpless. There's nothing you could do. So a wise person wants to take responsibility for their disease when possible. And so this guy, he starts watching nutrition and health videos online for free. This cost $150,000. This is free. He especially studies the work of Dr. Caldwell Esselstyn. He gets his total cholesterol down below 140. He optimizes his body weight. His flag is now running again at full mass. His wife is annoyed because he wants her every day, and she says he thinks he's a newlywed. And he also gets frustrated going to the store. He's not sure what food to buy, and he's lost so much weight. Now he has to buy new clothes. It's going to cost him some money. And for a whole month while he was changing his diet, he was kind of going back and forth, still eating some meat and dairy and oil products before he finally quit them all. He was getting the farts, okay? And he's having Hershey squirts in his underwear. So he's a little pissed off. Ask yourself, whose problems would you rather have? Exhibit A or Exhibit B? All right, now this is going to make sense here in a moment, but here's the Last Supper. And here's Jesus Christus with the Holy Grail cup, which he used at the Last Supper. Then when Jesus Christus was put on the cross, he had 5 wounds, both hands, both feet, and in the chest. So those are the 5 wounds of Jesus Christus. Here's Longinus, the Roman soldier who put a spear into his side. All right, well, when they did that, someone put the Holy Grail cup there, and they caught the blood and the fluid that came out of the pleural space, and that was called the Holy Grail, and it is said to have almost magical healing properties. And then these are King Arthur's Knights of the Round Table, where they were trying to, the Holy Grail had become lost for centuries, and they were trying to find it. And only Galahad, who earned it, who had made himself worthy, was able to get it. So even though Lancelot was the best knight, Lancelot had gotten himself into risky business with Guinevere, and he no longer was worthy to find the Holy Grail. Okay, so, then like I said, I told you, the cardiologist, the vascular surgeon, the open heart cardiothoracic surgeon, they're all basically just plumbers trying to get past a blockage. And if somebody actually thinks the way, the joke is that you dishonor your profession, Billy, to try to actually understand this disease. So, all right, this is William Roberts. What I actually had, my slide maybe are a little out of order. It'll make sense in a moment. This guy did a lot of work as a cardiac pathologist to show the truth about atherosclerosis. I think I'm missing a slide. Too bad. So what I was trying to show you, the reason I was showing you is I made a joke that there's the 5 wounds of the village idiot who goes for open heart surgery when they could have cured themselves with a cabbage. And the 5 wounds are, number 1, they get a sternotomy. Number 2, they get a mediastinal tube. It's a pretty big tube, about 30 French, which means about a centimeter in diameter. Then they get a large diameter chest tube in the left chest. So that's 1 sternotomy, 2 mediastinal tube, 3, the 3rd wound is the left chest tube. They get a central line typically placed with the right internal jugular vein for a Swan-Ganz catheter. They leave a corded sheath in the SVC, superior vena cava. So that's 4 wounds of the average village idiot. And then the 4th one is they have a groin wound from the large diameter sheaths put in for cardiac cath, typically put in an arterial sheath and a venous sheath. Okay, so I lost a slide. Sorry about that. But I meant that to be the 5 wounds of the village idiot. That's why I showed all this stuff. And I had another slide too. Gosh, I kind of screwed this up. Where I had, for the Holy Grail, I just showed a fruit and veggie smoothie. Okay, and you got to be careful with those smoothies. They can make you go deaf. So you want to make sure you have ear protectors on when you make those. So sorry I screwed that up. But you get it now. It all makes sense. Okay, so here's William Roberts. And he's a cardiac pathologist. He did a study of over 2,000 autopsies on people who died of coronary artery disease. And he made the point that it's never a single vessel, which is often said to patients, we're just going to bypass or stent one vessel. He says it's never a single vessel. It's always diffuse, of similar severity. And you can't fix coronary artery disease with a bypass or stent because it's everywhere. It's not just in the epicardial large diameter coronaries. It's also in the small intramyocardial branches. And the plaques that cause fatal myocardial infarction are typically too small. You wouldn't even bother with treating them based on stenosis, narrowing criteria. So they can't find the plaques that are likely to become the initiators of thrombosis in a coronary. Okay, and he says you take herbivore animals from his research and you feed them a high-fat diet, they all get atherosclerosis. That's why I think going for cardiac calcium CT scan is a stupid joke, because you have it if you ate the SAD diet for a couple decades. So why even radiate your chest? You have it. Just accept you have it and deal with it, and start eating the correct diet. And he also makes a point, cholesterol is by far the most important risk factor for developing atherosclerosis, because the increased LDL cholesterol makes the red blood cells stick together. Okay, so this is the work of William C. Roberts. By the way, here's Gregory Sloop, and this is the best book ever written on atherosclerosis. I read every single one I could find, and I actually contacted him personally because I thought his work was so great and talked to him. And this is the atherothrombosis theory of atherosclerosis. And the most important thing to realize from this picture is both of these guys are pathologists. They could care less if you treat it with a pill, a diet, a stent, or a surgery. They just wanted to understand it. And they look under a microscope and they go, gee, it's a blood clot. All right, moving on. Okay, thesis number 4 from the Medical Reformation. Why do doctors treat type 2 diabetes with pills that have a 0% cure rate when it can usually be cured with a low-fat vegan diet? Okay, how come the average endocrinologist has not read the basic papers about diabetes? All they know is the drugs. Populations that eat low-fat diets, they almost never get type 2 diabetes. Conventional medicine is ignorant, and it is thus functionally illiterate. They know how to read, but they don't read, and it doesn't get in their books. Roy Taylor, he got his patients to lose weight, and when they lost 30 pounds or more, all of them that had diabetes 4 years or less were cured of it by losing 31 or more pounds. But how he did it, I actually think the way he did it with these like nutrition shakes was not a good long-term strategy. You need to find something you can eat the rest of your life and be happy with, which is, a low-fat, low-sodium vegan diet. All right, why do doctors treat hypertension with pills, which have a 0% cure rate? The patient has to take the pills for their whole life, and they gradually often have to add additional pills. Kempner showed you just put people on a rice diet, 1% of calories from fat. He used Uncle Ben's white rice, and he was able to cure tons of them, including some patients that started out with pressures in the 200s, systolics in the 200s. High blood pressure solution. This is the best book ever written on blood pressure. This guy, Richard Moore, MD, PhD, spent his whole life researching plasma membrane ion pumps and their relationship to hypertension. And what he basically said is our ancestors ate lots of potassium and magnesium and nitrates because they're all common in plant foods. And they ate hardly any sodium. And we do just the opposite. We eat tons of sodium, hardly any potassium, magnesium, and nitrates because we don't eat much plants. And that's why we're hypertensive. And he studied all these populations all over the world. It's the same thing. It's not rocket science, okay? Okay, and pathology books to this day, even, recent ones from the Ivy League schools say 95% of hypertension is essential of unknown cause. It's nonsense, okay? The populations that eat low-fat, low-sodium, plant-based diets, they don't get hypertension. The high-fat diets cause the red blood cells to stick together. Like I said, they're bridging molecules. Surgeons don't know the most basic stuff about blood flow. And, in the Bible, it says fear of God is the beginning of wisdom, okay? Socrates had said the proper naming of terms is the beginning of wisdom, okay? Aristotle had said removal of emotions is the beginning of an intelligent conversation. Okay, so what I'm saying here, fear of ischemia is the beginning of health wisdom. So ischemia means lack of oxygen delivery because you have poor blood flow. If you just learn that, I want every organ in your body functions better with good blood flow. So how do you have good blood flow? You avoid high-fat diets, you avoid sodium, and you eat the plant foods to get your vasodilators. So sodium is a vasoconstrictor, narrows arteries. Potassium and magnesium and nitrates are all vasodilators. They open up arteries. That's what you want. Okay, surgeons don't know basic stuff about dietary fiber, abdominal pressure syndrome. I've never had a single doctor, and I've asked tons of them, what is abdominal pressure syndrome by Dennis Burkitt? They don't know it. And the reason they don't know it is because they get tested for their boards on what's in the textbooks, and this never gets into the textbooks. None of these famous pioneers in nutrition, any of them are in the textbooks. Okay, Dennis Burkitt's in the textbook because he discovered a pattern of inheritance for Burkitt's lymphoma. He's not in any of the textbooks for his knowledge about dietary fiber and abdominal pressure syndrome. Vascular surgeons, they don't know about the diet. They don't know atherosclerosis is a blood clot. They don't know the difference between the nutritional content of meat and of plants. I can tell you, like I said, I know lots of them, and I know the ones who are good students. I did some of my training at Ivy League schools, and I also can tell you, I know the ones that are in the most competitive fields. They don't know any of this stuff. Okay, here is LDL cholesterol plotted against viscosity, blood thickness. The higher the LDL cholesterol, the thicker the blood. That's bad. Okay, here's the zeta potential of a red blood cell, negative charge on its outer surface because it's got cholesterol sulfates, heparin sulfates, and sialic acids. The negative charges repel each other, so the red blood cells do not stick together. You don't want them to stick together. A bridging molecule is something with a positive charge that overcomes the zeta potential. It's like LDL cholesterol, fibrinogen, the clotting protein, uric acid, IgM antibodies. That's why you have increased clotting with an acute infection. And also LPS and LTL. LPS, lipopolysaccharide, LTA, lipoteichoic acid. Those are bacterial endotoxins. LPS from the gram-negative bacteria, LTA from gram-positive bacteria. They all stick red blood cells together and increase the predisposition to clotting. Okay, and you get more of those when you have leaky gut because they're able to get across the intestinal barrier in larger amounts. Typical red blood cell is a little bit bigger than a capillary. It's about 7 microns. Capillary is only about 5 microns, so they have to deform a little bit to pass through the capillary. If you stick them all together with a bridging molecule like we just talked about on the previous page, now it's almost like pushing a submarine sandwich through that capillary. So to push thick blood through capillaries, you need higher blood pressure. Blood pressure goes up and causes all its attendant problems. This is some work done by Peter Cole in the 1950s. He's a cardiologist in Pennsylvania, and he found when you fed people a high-fat diet, especially a saturated fat, they would get this curve here, the black line. So normal low-fat diet is the green line. You never get hyperlipidemia in the blood. When you fed them sat fat, you would peak up in hyperlipidemia from about 4 to 7 hours, and then it would come back down. And what he did is he checked their blood lipids every 30 minutes. And these were cardiac angina patients, so there was obviously no IRB, internal review board, to decide if the study should be approved. He just did it. And they didn't even have any way to treat them if they should have a myocardial infarction at that time. But anyways, at peak lipemia, the patients had the most episodes of chest pain, and it correlated quite well. So then later in the 1960s, this experiment was repeated with omega-6 cooking oils, and they found it caused an even more prolonged sludging of the blood. So it's even worse. Okay, how come medical schools do not treat nutrition, epidemiology, and toxicology? I call that NET, N-E-T, even though those are the most important topics for improving health. And I went through all the biochemistry books, and they routinely recommend stupid things like the Mediterranean diet, which is completely stupid. And in my opinion, recommending the Mediterranean diet for these patients with chronic diseases, hypertension, coronary artery disease, diabetes, obesity, that's like treating lung cancer with cigarettes. That's like sending a syphilis patient to a brothel for treatment. It's completely stupid, okay? And even Ivy League doctors will recommend the Mediterranean because they don't know what they're talking about, and they're phonies. They want to pretend they know what they're talking about. Trust me, I've seen them recommending that for these chronic traumatic encephalopathy patients, like the pro football players that become demented from all the head trauma. This is absolutely stupid in my opinion. It's going to decrease blood flow. Okay, biochemistry books avoid most of the clinically useful topics like toxicology, fluoride, aluminum, mercury, chlorine, sodium, MSG, MFG, aspartame. You'll find none of the stuff, none of the important toxins of common food toxins, none of them are in the standard textbooks, okay? Mitochondrial inhibitors, for example. I was trying to understand mitochondrial inhibitors because I know it's a major cause of excitotoxicity in the brain because it decreases the brain cell's energy so it can't pump calcium out of the cytoplasm. And there was none of it. I own like 7 biochemistry textbooks, none of it in any of them. And then I go into the literature, I quickly find over 50 of them. Many of them are common. Medical students are taught that it's impossible to cure the chronic diseases, hypertension, diabetes, coronary artery disease, autoimmune, etc. And what I'm saying is they're trained to be learned helplessness. All right. And again, the motto of the allopathic school, we're the best. We're the standard of medicine. We're the gold standard. We always fail, but we're the best. Yeah, right. It's like a team that brags about losing every single game. It's pathetic. It's a disgrace. Okay, and in medical school, they never teach that religion makes people healthier. Oh, we can't talk about religion. That's right, because our system is based on atheistic Darwinism. And why is it based on atheistic Darwinism? Because atheistic Darwinism allows eugenics, okay? It allows all kinds of things. It allows basically the medical system to do anything it wants. And if you think about that a while, you'll start to understand how big a deal that is. It allows MAID, M-A-I-D, which means medical assistance in dying, euthanasia of patients, okay? That's a big thing, especially in Canada, all right? So they want it because atheistic Darwinism gives them a blank check to do whatever they want, anything. I'm not saying, when I say anything, I don't mean kind of anything. I mean anything. You know, they'll take aborted fetuses and they'll make medications out of them. Here's just showing mitochondria inhibitors. There's tons of them, okay? Saturated fat, of course, is a mitochondria inhibitor. Atrazine, routinely sprayed on non-organic GMO corn, all right? SSRIs, antidepressant medications. Metformin, diabetes medication, okay? Glyphosate, routinely sprayed on non-organic foods like soy, all right? Antifungals, preservatives to prevent mold growth, mold inhibitors. Super common, ubiquitous in your processed food. Quite often, they are intermitochondrial membrane complex 2 inhibitors. So they are thus also going to be excitotoxins because they're going to decrease the ability of that cell to make ATP and pump calcium out of its cytoplasm. So brain cells are at increased risk to die. In addition, they're going to increase insulin resistance because what causes insulin resistance? Saturated fat blocking intermitochondrial membrane electron transport. Okay, so what I'm saying is these are poisons, okay? Mitochondrial inhibitors are significant metabolic poisons and neurotoxic poisons, all right? Neurotoxins, all right? F- in your water. Yeah, like it's going to help your teeth. If it's going to help your teeth, why do you drink it? Why isn't it just topical? Okay, it's for chumps. All right, here's H&E, hydroxynonenal. It's a toxic aldehyde produced from eating omega-6 oils. That's also an inhibitor of ATP synthase, complex 5 on the intermitochondrial membrane. All right, so I'm just showing you. These are common things. Tylenol, you know, is also known as acetaminophen. It's a mitochondrial toxin. And there's other ones, you know, these heavy metals, aluminum, iron. And there's other mitochondrial toxins that don't necessarily inhibit the intermitochondrial membrane. Things like alcohol, arsenic. Traumatic brain injury has a similar effect on pyruvate dehydrogenase. Silver affects this pathway as well. So anyways, and here's all the wonderful regulatory agencies that you can trust to help you. And they all approve F- in the water. You can look them up yourself, okay? You know, what does it do? It creates a bunch of dumbed down people that are, you know, docile, easy to control, a bunch of chumps, all right? So those are the institutions protecting you. They're laughing at your face. They could care less about you. They have zero interest or care or respect for you. Okay, and so you need to realize that. Once you realize you are on your own, then you have a chance to wisely learn what you need to know and to navigate the complex world. You know, my kid came to me one time. He said he got ripped off on a grade by a teacher. This was many, many years ago. And he's like, well, you know, should he complain or what could he do? And at that time, it wasn't a big deal of an assignment. He was just a pretty young kid. I said, look, imagine there's a rabbit out in the forest, you know, hopping down the bunny trail. It looks up in the sky and it sees there's a hawk up in one tree. It looks down the path in the other direction. There's a big snake. It looks off, you know, just off the path to the other side. There's a bunch of coyotes. And I say, can the rabbit ever expect that the snake, the coyotes, you know, and the hawk are ever going to leave him alone? No, they're not. It's just the way it is. So if the rabbit, if he's wise, he'll learn to stay alert, pay attention. He'll make a system of burrows. He'll make friends with the birds, you know, the alarm clock, if you will, the alarm of the forest to notify him. He'll pay attention to him. He learns how to navigate the environment, but they're never going to be nice to him. And that's what I'm trying to tell you. These companies want to make money. They could care less about you. The regulatory agencies are all paid off and fake. No one is going to protect you. You have to learn what's going on and protect yourself or you're screwed, okay? And if you don't think that's nice, too bad. That's how it is. Let's see. What else? Okay, so, all right. Then why do medical centers recommend the Mediterranean diet? I call the Mediterranean diet the Antichrist because it makes people sick. They promise salvation with it, but it leads to health hell. It makes people sick. It's a big lie, okay? Also, you know, I read all these articles and I found out that basically the same things that promote good health of the blood-brain barrier also promote the gut barrier and vice versa. And so things like a stroke or traumatic brain injury, they're going to impair the gut barrier. And that's a big deal because when you're eating food after this acute brain injury, you want to eat your fiber because if you fix the gut barrier, you also help fix the blood-brain barrier. The butyrate used from the short-chain fatty acids made by eating fiber, it also helps maintain the blood-brain barrier. Because if you have a brain injury, a recent stroke or traumatic brain injury, and you then simultaneously have leaky gut, that means more toxins get through the gut, and then they subsequently get more of them through the blood-brain barrier, and you expand the injury. So let's say here's a patient with frontal head trauma. He's got a left frontal lobe, superior frontal gyrus, small, about 1 centimeter diameter, acute intraparenchymal hematoma. Okay, well, if he eats wrong, he's going to expand the brain that's injured by that. Maybe it'll be, instead of a 1 centimeter diameter, it'll be a 2 centimeter diameter destruction of brain tissue. So you want to protect it. The surrounding tissue to a stroke or a brain hemorrhage, we call it a penumbra. Penumbra means like twilight. And that's the brain tissue that's at risk. You might save it, you might not. So you want to do everything right, so you save it, okay? And I actually I teach neurologists about the brain. I tell them, look, you guys should change your guidelines for post-stroke and post-traumatic brain injury management, okay? I've gone through the Ivy League textbooks in neurology, and they're a joke. They're all stupid, okay? They're pathetic. They'll talk about Alzheimer's for dementia. They don't know any of this stuff. They don't know excitotoxicity. They'll have one paragraph on excitotoxicity in the context of stroke, in the context of epilepsy. That's a joke. It should be the main chapter in the book, okay? So one of the reasons why you sometimes say, why am I so confident? I'm confident because I know what's going on. And believe me, it's messed up. The typical average pro trusts the health system because they're a bunch of chumps, okay? You should not trust it. It's designed to sell drugs and make money. It is not designed to help you, okay? Why? No, okay, so here's thesis number 10. Why does the adult psychiatry prescribe drugs that hardly ever cure anyone, but have lots of side effects? This guy, Dr. Bregan, Harvard psychiatrist, I think he recently died. He was a really old guy. I think he's the greatest psychiatrist who ever lived. And here's what he said. He said, this is his textbook, by the way. This is his textbook that really is like a pharmacology textbook. And he's written a bunch of other books, but this is the best one for understanding the side effects of drugs. He says that almost all psychiatric drugs, he basically says pretty much all of them, they basically just cause a slowly progressive lobotomy, okay? Here's another psychiatrist lady, Grace Jackson. She's real smart. They both have internet videos. You can just search the name on internet videos and watch their lectures. She said that basically psychiatric drugs cause dementia. She says that basically the same thing as Bregan. They cause a gradual lobotomy. And she calls drug-induced dementia a perfect crime because the drugs are making the person demented and nobody realizes it's a drug. But if you actually study the drugs and what they do, it's obvious. And I actually read a paper not that long ago, and they were talking about recommending Prozac, fluoxetine, should be used as a chemotherapy. I thought that was funny, that the drug was so toxic, according to this article. Okay, how does it all work? In the brain synapse, let's say this is the presynaptic neuron here. It releases its neurotransmitter. The transmitter vesicle merges with the plasma membrane at the synaptic cleft. The green little circles are the transmitter. They diffuse across the synaptic cleft, and they bind to a receptor on the postsynaptic neuron, and they exert an effect. In this case, the neurotransmitter is serotonin. Well, if you give a drug like an SSRI, selective serotonin reuptake inhibitor, it blocks this reuptake because normally it's taken back up to a reuptake channel and then put back into a vesicle. Well, they will block this. But as Dr. Bregan says, the brain fights the drug. They'll make more reuptake channels if you block some of them. And the postsynaptic neuron will also compensate by having fewer receptors. And the point I'm saying is, if somebody started out a little sad and depressed for whatever the reason, you're now starting to change their brain synapses. And the more you change these things, the less chance you have of getting back to your baseline, okay? So it's a pretty dangerous thing to be doing. And typical synapse, they try to show it like I did on this previous page, that there's just one neurotransmitter, and it's just a simple process between two neurons, the pre and the postsynaptic neuron. But in reality, it's more like this, where you have a lot of neurons that are interacting with each other. It's more like a symphony. It's not a, one guy playing guitar, okay? And it's complex. So you start messing around with one neurotransmitter, you're going to get all kinds of compensatory adaptations, and you have the risk of really messing things up. By the way, about 90% of brain neurotransmitters are glutamate, and it's like an on switch, okay? About 5% are GABA. And then all the common ones that everybody knows, norepinephrine, serotonin, dopamine, acetylcholine, those are really only about 1% each. They're sort of modulators, just so you know that. That's kind of worth knowing. All right. So anyways, here's my joke about the future of psychiatry. The patient walks up to the front desk and they say, everything is based on science. And they say you can have, door number 1, chemical lobotomy with psychiatric drugs. Door number 2, surgical lobotomy. Door number 3, electroconvulsive therapy, ECT, and electrical lobotomy. My advice, run for your life. All right. Psychiatry is one of the worst fields in medicine. It's totally overrated. And don't get me wrong, I know a lot about psychiatry. My father was a psychiatrist. My father was a good guy. He did the best he could. But what I'm trying to say is most doctors, they sort of read what they have to read, study what they have to study, do as they're told, follow the standard guidelines. And the standard guidelines are written by somebody at a famous medical center who's getting paid to promote the drugs. That's how they get their grant money for research. So they're sort of paid off. And doctors are rewarded for being conformist and obedient. They're not rewarded for caring about patients. You got to be polite to a patient, but you don't have to care about them or do right by them. And I think my father meant well. I just don't think he knew that much, okay? I think like all the other ones, he just believed what he was told and went with it. He didn't actually think and study about it like I do. I mean, I ask myself basic questions. What causes diabetes? What causes hypertension? What causes neurodegeneration? What causes autoimmune disease? And then I read about it for months until I feel like I've understood it as best I can. But as my wife says, I'm an autistic robot. Okay, regular doctors, they don't do that. Hardly any of them do that. But once you do that, you start seeing things very differently than the textbooks of conventional medicine. Okay, why do urologists operate on so many prostate cancers? The Ornish study, 98 biopsy-proven patients. What they found was, the patients did better by just a vegetarian diet. They maintained their PSAs or lowered them and didn't need to go on to radiation or surgery, okay? Compared to the guys who went with their standard diets, they were much more likely to have their PSAs keep going up and then be pushed subsequently into surgery or radiation, for example. How come impotent men are not told that they can go low-fat vegan typically, okay? All right, what about kidneys? How come the kidney doctors know so little about nutrition? They tend to be very good at, writing orders for the dialysis machine, but they tend to not know almost anything about nutrition. Okay, what does a kidney do? It excretes nitrogen. So if you want to lower the workload of a kidney, eat less protein. Okay, there's only nitrogen in protein. There's no nitrogen in fats or in sugars, in carbohydrates. So doesn't that make sense? Give the kidneys a vacation so they have a chance to heal. The stupidest person could understand that. That's so obvious, but it's not routinely done. All right, and here's a good book on protecting the kidneys by this guy, Lee Hall. He was a smart patient who had kidney failure, and he figured out how to cure himself. And basically, he went towards low-fat, plant-based diet, okay? And now here at Pediatric Psychiatry, this is thesis number 13. Why does pediatric psychiatry prescribe amphetamines to children when it would be illegal to sell these to an adult on a street corner? Okay, it's insane. It's insane, okay? And I think this modern so-called, what they do is they'll take a euphemism and they'll trick you, like this modern gender-affirming care. That's a euphemism. What they're really doing is castrating children, okay? Some poor little kid. Like when I was young, I luckily went through school before all the drugs came out, and I was hyper. I think it was just because I was smart. I would do the homework in 5 seconds, and I want to joke and make my friends laugh. I was labeled as hyperactive. Just so you know, I was put in like the equivalent of solitary confinement for 2 years where I had to be in a pod classroom where I was by myself and I wasn't able to talk to anybody. I just read by myself. That was school for me. I hated it. Finally, my mom actually I liked wrestling as a sport. My mother told me, look, no ride to wrestling practice unless you stop getting in trouble in school. So I'm like, okay, Mom. And that got me to be good for a couple of years. But the point I'm making is if I had come along not even 5 years later, they would have drugged me as a hyperactive kid, okay? And who knows what else they would have done to me. Now it's even worse. They ask the little boys, do you ever wish you were a girl? And then they'll castrate you, okay? It's insane. It's insane. And people should say it's insane. It's not reasonable. It's not another point of view. It's insane. It's not in the best interest of children. So anyways, given all these powerful amphetamine drugs to children, they have very severe long-term side effects, and they often end up being psych patients on multiple psych meds. And so I'm going to relate this to something from Julius Caesar by William Shakespeare. And here's a painting of Mark Antony at his famous funeral oration for Julius Caesar. He started out, Mark Antony, friends, Romans, countrymen, lend me your ears. I come to bury children, not to praise them. The noble psychiatrists who have told you that amphetamines are good for children, and psychiatrists are honorable men. You all did love children once, and not without cause. What cause withholds you then to mourn for them? O judgment, thou art fled to brutish beasts, and men have lost their reason. Bear with me. My heart is in the coffin with these children, and I must pause till it come back to me. Okay, all these children are being poisoned and nobody gives a rat's tail. You know why? Because they're a bunch of poor, ignorant people. Okay, so no one cares about them. And that's what I meant by the medical system does not care about anyone. It will poison a child. Now, would you poison a child? The average person would say no. Even if you hated the family, hated the ethnic group, hated the religion, hated everything about them, would you poison a child? The average person would say no. They'd say, no, I would not do that. I have my own personal ethics. It does not matter the circumstances. I would not do that. But the medical system does that every day. What kind of a system is happy to poison children all day long? It's sick, okay? It's sick. It's not only stupid, it's evil. Okay, and so this is just a parody of the speech from Mark Antony about Julius Caesar from Julius Caesar, written by William Shakespeare. Here's a book, Anatomy of an Epidemic by Robert Whittaker. It's a very good book. And along the lines of, the other two I just showed you by Bragan and Grace Jackson, these drugs cause brain damage. They're really bad. Okay, now let's talk about, so why do pediatricians give toxic drugs that do more harm than good? Okay, next topic. Thesis number 15. Why do cancer doctors often give chemotherapy even when they know it's not going to work? Now, don't get me wrong. I wouldn't say they know it's not going to work, but they know it's unlikely to work. What I'm getting at is there are some cancers that respond well to chemotherapy, but there's a whole bunch of them that have never been shown to respond well to chemotherapy, and they tend to give it anyways. And I know why they do it, because they basically assume the patient is dead anyways. We might as well give it a try. But they're ignoring something. They're ignoring the fact that these drugs have a lot of side effects. And if you only have a couple months left to live, wouldn't you rather spend that time with your family than just be vomiting from chemotherapy that doesn't work in a hospital? No. And they get paid tons and tons of money. Very profitable stuff, chemotherapy. Sometimes it's appropriate, but a lot of times it's given when it is not. This lady, Ruth Heidrich, she was diagnosed with metastatic breast cancer decades ago, I think like 30 years ago, and she's still alive, and she ran triathlons and marathons and stuff. This lady, something similar, diagnosed with metastatic breast cancer. She was also diagnosed with metastatic breast cancer. And instead of going down the surgery chemo path, she chose a vegan diet. She ran, all around the perimeter of Australia. She ran a marathon every day for 365 days in a row. And that's her husband, who's also a marathon runner. And she's still alive, like over 20 years later, with metastatic breast cancer, okay? This lady here is Kelly Turner. She was working at one of the big cancer chemo centers out east, and she had a patient who had survived metastatic cancer for many, many years, way beyond the average survival curve. And she's like, that's extraordinary. So she talked to the patient. How did you do it? What did you do? What do you think made you able to survive? She was fascinated by it. But then she went and talked to others at the cancer center, and no one seemed interested. She's like, how come you people aren't interested in this? Here we have what we're all hoping for is a great result, somebody who survives metastatic cancer, and no one's interested in the results. So then she started looking through the literature, and she saw there were a whole bunch of patients who had survived metastatic cancer for a long time, a bunch of case reports in the journals. And she's like, why doesn't somebody collect all this information and put it together? And it's for the same reason I told you earlier. Cure the patient and you lose a customer. There's no money in cures. The money comes from keeping them sick and keep on drugging them. Okay, so she went and studied all of them, and she actually went around and traveled around the country interviewing people who had survived metastatic cancer, and she wrote a book about it called Radical Remission. Okay, the next thing is, how come ophthalmologists do not recommend low-fat, low-sodium vegan diet? Because they see tons of patients with diabetes, diabetic retinopathy, hypertension, hypertensive retinopathy, even though Dr. Kempner had shown lots of patients can reverse their retinopathy with these diets. Instead, they zap them with lasers. Okay, and look at how the public is lied to. Okay, so here's some advertising. Why you should wear deodorant at night. And okay, here's another, ignorant lady doesn't know any better. She's putting deodorant on. She shaved her armpits. Upper outer quadrant breast cancer used to be about 25% of breast cancers back in the 1920s. Now it's 60%, so it's more than double. And it's thought the main new risk factor is this deodorant stuff because it'll typically contain aluminum to plug up the pores, sweat pores. But the aluminum is a metalloestrogen. You got shared lymphatics between the upper outer quadrant and the armpit, the axilla. There's also going to be preservatives on there, typically things like parabenzoic acids, which are estrogenic chemicals. And you're basically having shared lymphatic between the breast and the upper outer quadrant, okay? And then when you shave first, you get increased transdermal absorption. The point is, when you walk in a room, you say, hey, how you doing? We don't sniff each other's armpits. We don't smell each other like dogs. It's just stupid conformity to wear deodorant. I think it's just another demonstration of low IQ conformity. So not smart. Okay, another thing about how people get breast cancer, they're estrogen overloaded. So the first question, too, is how does the body get rid of estrogen? Your endogenous estrogens, those made by your body, they're excreted by the liver through what is called conjugation. The estrogen molecule is bound to another molecule called a glucuronic acid. This is glucuronidation. The glucuronic acid is like a glucose with a carboxylic acid on it. It attaches to the estrogen. It's excreted into the bile. The conjugation makes it more soluble in the bile, which, remember, is a little bit more water-like than people realize. It then goes out through the intestinal tract, and we defecate it out of our system. That's how we lower estrogen levels. Well, guess what? There's only two main types of gut bacteria. If you eat high-fiber diet, you have the good bacteria. But if you don't eat enough fiber, you get the bad bacteria. The bad bacteria have more of an enzyme called glucuronidase. And what this does is it separates this bond here between the estrogen and the glucuronic acid. And once the conjugation is removed, the estrogen will be reabsorbed in the blood. And so the person will have higher estrogen levels. And the other thing people aren't aware of is tap water has very high estrogen levels in it. It has aluminum, a so-called clarifier. It's got other women's birth control pills, phthalates, BPA, and all kinds of things because it's too expensive to carbon filter municipal water. So what happens is people who drink tap water, eat meat, oils, processed food, use deodorant, they are really cranking up their estrogen levels. And I've had women tell me every single woman in their family had to get a hysterectomy before age 35 because of fibroids. Well, guess what? Having a uterus and menstruating every month really protects a woman because it lowers her hematocrit, her red blood cell count, and it makes more of the red blood cells have to be replaced. So coming out of the bone marrow, red blood cells are more flexible. They live about 3 months, 120 days. Early on, they're less glycated. They got less phosphatidylserine externalization. That means movement of that particular phospholipid from the inner leaflet of the plasma membrane to the outer leaflet of the plasma membrane. So the red blood cells are more flexible. They can deform more readily, pass through the capillaries, and it lowers blood pressure. Lower blood pressure means less atherosclerosis, less stroke. So whenever I see a demented brain and it's a woman, at a younger age than expected, let's say, between 45 to 65, first of all, I always check the usual suspects. Is she a drug addict? Is she an alcoholic? Did she have head trauma? But once you get outside of that, then if it's not, that doesn't explain it. Usually the explanation is I go in the chart and she had a hysterectomy. Okay, Mayo Clinic did a study on around 2,400 of them, and they found that women who have a hysterectomy before the age of 35 dramatically increase incidence of congestive heart failure, coronary artery disease, and other health problems. Okay, some papers showed dementia as well. All right, so anyways, here is my thesis number 18. How come one almost never hears of dermatologists telling people to avoid sunscreen, deodorant, and other personal care products? Okay. I doubt they know about this. I watched a whole bunch of videos on the internet about dermatologists. I didn't hear a single one talking about this. So here is cholesterol. Cholesterol is the backbone of the steroid hormones like estrogen. Okay, so cholesterol has 4 cyclic rings, and then it has a hydroxyl group coming off the A ring. Okay, estrogen is a little bit different in the sense that the A ring has 3 double bonds. That means it's a benzene. It's also called an aromatic ring. Aroma has a smell to it. The hydroxyl group that comes off OH, also called an alcohol group, it's antimicrobial, prevents mold growth. So they love it. It's a perfect preservative. The aromatic ring of 3 double bonds resonating amongst these carbons gives tremendous shelf life. It'll stay on the shelf for years. And this makes it antimicrobial, preventing, in particular, antifungal, preventing mold growth. So you get exactly what you want. It's the perfect chemical for these companies. Good shelf life, antifungal. Perfect, okay, but it makes people fat and sick. Estrogen in general is a fat storage hormone because it tells they go up a lot when she's pregnant. It tells her body to gain weight because the baby might need that for energy. So when a person has higher estrogen levels, they're more likely to become fat when they're abnormally high. Okay, how come neurologists do not put multiple sclerosis patients on the Roy Swank diet, even though he has by far the best results? He had like 32-year follow-up, even 50-year follow-up on some patients with by far the best results. Neurologists don't know it. They don't know about this. Here's the Roy Swank book, okay? They don't know anything about these toxins because I know them. I'm friends with a lot of neurologists. I talk to them all the time. They don't know about dietary fiber protecting the blood-brain barrier. They don't know about how to improve blood flow from what I talked about. They don't know the deletory theory. They don't know my theory. They don't know Yamashita. They don't know any of this stuff. They just know the stuff that's in their standard textbooks, which is Alzheimer's, which is a joke. If you want to learn more about these things, Martin Paul is this brilliant sort of biologist, physicist, especially a physicist, who figured out a whole bunch of issues regarding a lot of these rare chronic diseases. Excitotoxins is a good introduction to the topic of excitotoxicity by Russell Blalock, written in 1997. I go way beyond his level of explanation, but it's good. I like him. He's good. He's pretty smart. He's a neurosurgeon. He's a smart guy. I don't agree with all his nutritional treatment recommendations. He's got a whole bunch of nutritional supplements that he recommends. I don't go down that path, but I will tell you his understanding of excitotoxins was way ahead of his time. Jack Delatorre, he's the guy who figured out the mouse equivalent theory. That's a very good theory of dementia. Basically, tied off carotid arteries, and basically middle-aged mice would become demented 2 months later. And when he first opened up their skull to do an autopsy, he figured he was going to see a big stroke on the same side where he tied off the carotid in the neck. And what he found, though, the brain was just shrunken on that side. That's due to apoptosis, programmed cell death, due to cerebral hypoperfusion, lack of blood supply. And you would say to yourself, well, how many people have an occluded carotid artery? Not that many. Yes, that's true. But how many people have AFib, underperfusion of the brain? Lots of them. How many have congestive heart failure, underperfusion of the brain due to lack of cardiac pumping? AFib, you get a lack of atrial filling of the ventricle, so you drop the cardiac output a bit, especially when it's at a fast rate. Okay, when you got CHF, you can't pump so well from the heart. What else in here? You got aortic stenosis, cardiac valve disease, aortic stenosis, aortic regurg, less blood to the brain. So what I'm trying to say is there's a whole bunch of things that'll do it. And the biggest one is not even on here it is, overtreated hypertension. Overtreated hypertension, you drop perfusion of the brain, that's going to increase your risk of stroke. So you got to be very careful, because a lot of people think, the more I treat my hypertension, the better. No. You might pass out and crash your car. You might pass out and fall down and get injured from that fall. You got to be real careful not to overtreat hypertension. Okay, and these are the 3 levels of the brain. If you look, this is the coronal section of the brain. This is the right side. This is the left side. You can always tell. So imagine the patient's feet are towards you for all imaging, CAT scan, MRI, CT, ultrasound. Okay, so at the level of the basal ganglia, the deep nuclei, right where the middle cerebral artery comes up, this is where you get a lacunar infarctions from hypertension. The next level of the brain is the corona radiata at the level of the lateral ventricles. And I put a skull and crossbones here because you get tons of strokes in this area. I'll explain why in a moment. I've seen some patients with over 100 little strokes from this situation I'm about to describe to you. Centrum semiovale is simply the deep white matter, myelinated fibers above the level of the lateral ventricles. So what happens is, again, the purpose of blood pressure is to get blood to the top of the brain. These penetrating arteries that extend from the convexities into the brain parenchyma, they don't have very good collateral circulation. So you get atherosclerosis in them, and you got a big risk of having small strokes in this myelinated brain tissue. If you have severe hypertension, you're going to keep getting atherosclerosis over time. If you overtreat the hypertension, you can't get blood up to the top of the brain down into this area. So I see tons of strokes in this area. Every day I see a bunch of them. Okay, and then here's my theory of dementia, the Peter Rogers MD theory of dementia. And no one knows this. And they wouldn't. I tried to publish it. They refused to publish it in several journals. And so I just wrote a book about it. Okay, and then I also have chapters on it in this book, and I give lectures on it. I've kind of given up on conventional medicine, conventional journals. They're owned by big pharma, okay? And they're going to publish stuff that helps them sell drugs or sell medical devices for surgery. They don't care about the patients. Patients are irrelevant. I never met any hospital that actually specifically tracks patient outcomes. And no one's going to ever track patient outcomes, because if you started keeping track of how your hypertension, diabetes, obesity, coronary artery disease, autoimmune patients did, what their outcomes were, you would then have somebody compete with a low-fat vegan diet, and it would kick the crap out of everybody else. And it would be so obvious if you ever published those rates of cure that it would make the jokes look like a drug. They're not going to do that. They're not going to let the drugs look like a joke. Okay, so they're never going to track outcomes. They're going to track efficiency and productivity and turn conventional medicine into an assembly line to just run the chumpy pros through it and take all their money and pick their pockets, okay? So basically what this means here, MR is a metabolic rate. That's how active the neuron is. And then GOD is glucose oxygen delivery. And normally they're matched. That's called neurovascular coupling to match the metabolic rate to the glucose oxygen delivery. Typically, this will be abbreviated OGD, oxygen glucose delivery. As a joke, I just made it GOD, glucose oxygen delivery, okay? And you can see that word that spells. All right, so what's the point? If you decrease glucose and oxygen delivery, in part like the things that Delatorre talked about, then you're going to have less ability to meet the metabolic needs of that neuron. If you make it worse, you pile on with mitochondrial inhibitors so the mitochondria doesn't work. That's the equivalent to lowering the glucose and oxygen delivery. You're going to have a wider and wider gap. The wider this gap gets, the more these brain cells are going to die. And typically what happens is you just start piling on all these risk factors. All right, they've got atherosclerosis, they're hypertensive, they're diabetic, they're obese, they eat a high-fat diet, they eat a high-sodium diet, they don't eat their plant foods, they don't have their vasodilators, they don't have their magnesium, they don't have their potassium, they don't have their nitrate precursors and nitric oxide, they don't get their sunshine to activate their skin subcutaneous precursors and nitric oxide. They wipe out their conversion system in their mouth with, F- toothpaste and mouthwash. They ingest inhibitors of SERCA. They're exposed inhibitors of SERCA, sarcoplasmic, endoplasmic reticulum, calcium ATPase. They ingest all these mitochondria inhibitors. They can't make ATP. They can't make energy. They can't pump calcium out of their cytoplasm. They go into excitotoxicity, or they take stimulants. Stimulants are MSG and MSG. They're excitotoxins, increase glutamate transmission in synapses, which increases glutamate, makes the neuron more active. So that means they're stimulants. Excessive psychological stress increases glutamate. Sleep deprivation and caffeine and corticosteroid medicines are perceived by the brain in a similar fashion and increase glutamate transmission, so they cause excitotoxicity. Tobacco, amphetamines, attention deficit meds. Glyphosate is also an excitotoxin. BAP is beta amyloid protein oligomers. All of those stimulant-like effects combined with this lack of glucose and oxygen delivery, lack of mitochondrial function, widen the gap. So you lose your neurovascular coupling. You can't provide enough energy to these neurons, and they get overactivated and they die. They go into apoptosis. So that's my theory, Peter Rogers, MD theory of neurovascular dementia. That's called it's really a tremendous expansion of the calcium hypothesis. Also, cell phones will open up voltage-gated calcium channels in the brain, so they have the equivalent effect of being stimulants. And that's bad. And the new stuff coming up is pulsed, and that's even worse than the old stuff with continuous. And some people even predicting that there's going to be tons more dementia because of that. Okay, how come infectious disease doctors, they don't know about postprandial bacterial endotoxemia. They don't know about most forms of dormant bacteria. They don't know about siderophores from iron overload. They don't know any of this stuff. And I talked to them. If you want to learn about these things, Rizia Portorius, real smart lady, PhD from South Africa. Douglas Kell, real smart PhD from England. They figure this stuff out. They're some of the most popular science journal authors you will find, but physicians don't know anything about them. They deserve a Nobel Prize. They'll never get it because, they don't. The big money doesn't want the doctors learning about this stuff. Okay, here's an example of relevant stuff. If you have leaky gut, you get increased bacterial endotoxin traveling across, absorbed from the gut into the blood. The gram-negative bacteria make LPS, lipopolysaccharide endotoxin. The gram-positives make LTA, lipoteichoic endotoxin. A lot of people are also iron overloaded from iron-fortified foods and meats. All of these things interact in a negative way with blood proteins like fibrinogen, a blood clotting protein, which normally is wrapped like a slinky. This is called an alpha helix secondary protein structure, and they will distort it, and it'll become what's called a beta-pleated sheet, like a deck of cards, and it'll stack up. The bigger a molecule is in aqueous solution and water-like solution, which is the solution of the body, the blood, the extracellular matrix, and intracellular, the more likely they are to precipitate. When they precipitate, they're non-functional. And in the context of blood clotting proteins, that means forms of blood clot. And they make these blood clots that are called dense matted deposits that are very refractory to dissolving through clot lysis. So they're more likely to plug up things, to plug up small arteries in your brain or in your heart and cause cognitive impairment and cardiac dysfunction. And this is a major problem. Infections can do this. Viral infections can do this. This is a major problem that hardly anybody knows about. And your infectious disease doctors won't know about it. I had an internal medicine doctor who came to me and he said to me, he goes, Pete, you're the smartest doctor. He says, out of all the doctors in the two hospitals I work, you're the only one that understands this stuff. You really should be teaching us, giving us lectures. Okay, so here's the scoop on leaky gut. You've got here the enterocyte lining of the intestinal tract under normal circumstances. It's a single cell thick. The TJs are tight junctions. The TJs are maintained by eating dietary fiber. The good gut bacteria convert it to short-chain fatty acids, in particular 4-carbon butyrate. The 4-carbon butyrate is used by the enterocytes to make tight junctions. You need tight junctions so bad stuff can't get across this intestinal barrier. All right, now if you don't have intact tight junctions, here they are drawn as open, unlike these that are closed. Now these bacteria, these are the bad bacteria. They can produce these endotoxins, and those can get across the open tight junctions, and they can cause clotting in the blood, or predisposition to it, increased risk of it. All right, in addition, big chunks of protein can get across, and these protein chunks coming from an animal can have an amino acid sequence similar to the animal's own protein, our own protein. So that's called molecular mimicry. Normally, you can only absorb 3 amino acids at a time connected to each other. That's called a tripeptide. But when you have open junctions there, you can absorb big pieces. Antibodies will form to it because they recognize it as formed from our body. But these antibodies sometimes, because the amino acid sequence of an animal protein from meat can be similar enough to our body's own proteins, they can cross-react. So if you ingest some thyroid in a hot dog, you can form an antibody to it, and that can cross-react with your own thyroid and predispose you to thyroid autoimmune disease, Hashimoto's or Graves, excitotoxicosis. You can form autoantibodies to other parts of your body. It's thought that dairy proteins are the ones that cause type 1 diabetes. A lot of papers on that. It's thought that this is also relevant to other autoimmune diseases, lupus, multiple sclerosis, etc. So if you don't want leaky gut, here's the things that cause it. Avoid them all. Eat your dietary fiber. Avoid F- in your water. Avoid chloride in your water. Avoid these detergents. There's a whole bunch of things you do. Avoid certain medications like NSAIDs, aspirin, PPIs. All right. So anyways, how come orthopedic doctors know so little about the benefits of the low-fat, low-sodium vegan diet for minimizing arthritis? Okay. And then also, what's the stuff about giving calcium supplements? They started to realize that calcium supplements should not be given to women anymore for prevention of osteoporosis. When they looked at the death rate of women receiving calcium supplements over 1,400 milligrams per day, it caused a 2.6 times increased death rate. So the poor woman's trying to help herself. And this is a big study, over 61,000 women. She's trying to help herself. And the women who are taking it, they're dying 2.6 times more often. All right, so what they think is that you get a transient bump elevation in the amount of calcium in the blood, and it's a clotting factor. It predisposes to clotting, and that'll cause heart attacks and cause them to die. Okay, how completely ignorant is that? Nobody knows about the spine stuff. I couldn't get this. These are my ideas on spine about that ischemic degenerative disc disease is primarily due to ischemia, lack of oxygen and blood supply. And there were some articles to that effect in like the 1980s, but I've expanded it entirely, not just degenerative disc disease. It's also disc, diffuse idiopathic skeletal hyperostosis with the bridging osteophytes. It's also interbody fusion. It's also OPLL, ossification of the posterior longitudinal ligament. It's also Bostrup's disease, fusion of the spinous processes in the back as well. All of this stuff is related. And the reason that happens is because when a disc fails, there's a lot of proprioceptors that sense motion in the spine because that has an important job to protect the central nervous system. So when they sense abnormal motion, 2 VBs in the disc is called a segment. When there's segmental instability, they recognize that. And, there's an old saying by Ralph Waldo Emerson, the hedgehog has only one trick and it's the best trick. And the spine has only one trick. It lays down calcification, ossification. So it will fuse the segment with the degenerated disc because normally the disc equilibrates the mass and the weight distribution when the spine moves. So once the disc is non-functional because it cracks because of ischemia, I meant to show it cracking. So the reason it cracks is the outer part of the disc is the annulus fibrosus, like a steel-belted radial tire in the periphery. Nucleus pulposus in the center is like a jelly donut. So when you crack the periphery, the annulus fibrosus, the jelly donut leaks out. The disc can just desiccate, dry out, and lose height. It can also herniate and start to push on things. All right, so what I'm saying is when the disc fails, it auto-fuses itself across the bones, and it can auto-fuse with bridging osteophyte. That's called disc, diffuse idiopathic skeletal hyperostosis. It can auto-fuse across the disc itself, interbody fusion, diffuse the two vertebral bodies. It can auto-fuse across the posterior disc, which is in contact with the posterior longitudinal ligament. So that's called OPLL, ossification of the posterior longitudinal ligament. Okay, and it can also fuse the spinous process. So what I'm saying is, it's a domino effect because as soon as one level fails, then you got accelerated degeneration of the adjacent level because it has to now bear more weight. So it fails sooner than it otherwise would. And the process marches itself all the way from the pelvis, the sacrum, up to the skull. Okay. And I figured this stuff out too because I look at thousands and thousands of spines. And if you read the spinal textbooks like from the 1990s, they're all stupid. They all say things like OPLL is a very rare condition, more common in persons of Asian descent. BS. I see it all day long every day. It's nonsense. Okay, the best book on estrogen is this guy right here, Anthony J, PhD. He has a YouTube channel. I think it's called Dr. Anthony J or something. A whole bunch of lectures. None of the doctors know anything about this. The endocrinologists don't know much about this. They're learning, though. I have had the experience. I've talked to some endocrinologists. They are learning about it. They want to read this book. They want to learn. So when it comes to estrogenic chemicals, I have seen some docs who really try to learn this. But, like the OB-GYNs, the ones I met in the past, none of them really knew. They know estrogen as far as the component of estrogen they have to deal with, but they were not familiar with these estrogenic chemicals and a lot of this pathophysiology related to breast cancer. I know that because my wife's a doctor and she had this friend, like lady OB-GYN doctor, who she said is so smart. And I said, fine, bring her over. I'll talk to her. Okay. So she came over. And so I started asking her all these questions and she didn't know them. I mean, she knew the usual OB-GYN stuff, but she did not know all this pathophysiology of estrogen related to breast cancer. It's pretty simple. Okay. Opioids. How come opioids are pushed so much on patients, even though they cause tons and tons of overdose deaths? I've known a couple of medical workers who had family members die from opioid overdoses. It's a really common thing. And all you have to do is say, stop prescribing opioids or prescribe them very rarely, very rarely. Don't let them into the country, but no one cares. Here is something, let's see, what am I talking about here? How come, this is thesis number 24, how come nutrition, epidemiology, toxicology are not taught in pre-med, med school, residency, or fellowship? Like I said, that's the joke. A medical student or a resident can tag along with me in 2 hours and I can teach them more about health and prevention and curing a disease than they learned in 8 years or even in 11 years, senior resident internal medicine. It's a joke, okay? And it's simply because big money doesn't want them to learn this stuff, so it never gets into their books. Their board exams are based on their books. Like I said a moment ago, they're swamped with work. They don't have any time to read and to think, really. You're rewarded in medicine for obedience, for respecting the hierarchy, for conformity. You are not rewarded for curing a patient. No one cares. No one knows whether the patient does well or dies tomorrow. No one knows or cares. Okay, if you follow the standard of care, it doesn't matter what happens to the patient. You can't get in trouble. That's why patient outcomes don't matter. What matters is follow that standard of care. Then you're clear. Okay, and the doctors want the patients to do well. They mean well, but look, they're only trained in prescribing drugs. That's what they're paid to do. That's what keeps them out of trouble. That's what makes money for the bean counter wherever they work. So everybody's happy. They're making money, but the patient gets screwed. Okay, number 25. How come there is no medical specialty of nutrition therapy? There ought to be a specialty called nutrition therapy. I'm good at studying and being a scholar, but I don't have any social business or marketing skills. I would love to start this as a specialty, but it would be blocked left and right. And they hire dietitians, but dietitians, a lot of them are very nice, but they usually don't know anything. And the reason I say that is big money companies like, these big soda pop companies and other companies, they fund the dietitian schools and teach them, that a high-fat version of the Mediterranean diet is a smart thing. It's stupid. Oh, this is a good biography of Dennis Burkitt, by the way. I kind of talked to him earlier, the guy who figured out abdominal pressure syndrome. And so what I'm saying is the scientific foundation of medicine, and all doctors are trained in internal medicine. Medical school is basically internal medicine training. It's like Alice in Wonderland through the looking glass. When I was young as a medical student, I was in awe of the big Ivy League pathophysiology textbooks and stuff. And I thought, isn't this great? You just match the ill to the pill and send a bill. And then now that I got a lot of experience, it's like being on the other side of the looking glass, the mirror, where the world looks quite different. And I can tell you the scientific foundation of internal medicine and the internal medicine fellowships is a joke. It is a house of cards. It's just designed to sell drugs, and it doesn't work. It reminds me of the caterpillar in Alice in Wonderland when she talked to him and he was just blowing smoke, okay, talking nonsense, all right? All these subjects taken by a pre-med, biochemistry. It has nothing to do with nutrition and health, organic chemistry, physical chemistry, physics, calculus, statistics. It's a big waste of time. And then the other stupid orientation classes they required them to take, they're all irrelevant. I've known medical students recently, not that long ago, they told me about their anatomy classes. They spent their first week learning to memorize the muscles of the back. That's completely stupid. I used to run a spinal injection clinic. I didn't even remember the name of some of those small muscles in the back. It's like the stupidest thing you could start a medical student on. They almost never learn the cause of a disease. They have essentially zero training in nutrition, toxicology, epidemiology. They get a tiny bit of epidemiology, but not in a way that's useful. So it's a big joke. That's why they're so ignorant. And then what happens is they run into what's called the Red Queen situation, whereby they're made busy. What they're judged by. There's always a bean counter at every hospital in the Western world that always tells them, how come you're not seeing more patients every day? The hospital on the other side of town, our competitor, sees 30 patients a day. You're only seeing 25. We expect more productivity from you. And can you imagine if that doctor starts sitting down with the patient, explaining nutrition to them, low-fat vegan diet? That'll take too much time. They won't even see 25 patients a day. They'll see 10 a day. And then the bean counter is going to tell them, look, you're only seeing 10, 15 patients a day. You're not pulling your weight. The other doctors are seeing 25. You better get your numbers up or we're going to have to let you go. So they got to play ball. And if the patient has a bad outcome and they didn't prescribe the standard of care drugs, then they could be sued and found negligent for not finding the standard of care. So all the pressure on them is go fast as possible, make the bean counters happy, and the patient's irrelevant. What happens to the patient? I'm sorry to say, but it doesn't matter. And what happens to doctors who don't play ball with big pharma and point out the problems of big pharma in a big public way? The Queen, big pharma, says off with their heads. Okay, they can get screwed, lose their license and stuff. So there's no reward for a doctor really trying to push. And I was a little bit pissed off just because I figured out all this stuff. Initially I was foolishly optimistic that I would cure all these patients, people would love me, and I'd make money. But what I've learned is this stuff is not welcome in conventional medicine. It is not welcome at all. Other doctors that have gone down this path and learned about it will tell you. So I don't use this stuff in my current clinical work, okay? But I use it in the sense that when I get a chance, I try to help patients and talk to them, or other people that come to me for advice. A lot of doctors come to me advice on how they can help themselves or one of their patients, and I explain it to them in that context. Plus, I make the YouTube channel and I write my books. But conventional medicine wants a doctor to work like they're on an assembly line and generate billing codes, make money for their hospital. That's how it is in the Western world. Okay, the American Medical Association, I said, could be named AMA. Instead of being AMA, American Medical Association, they could call it AMMA, American MERDER, for Money Association. The standard of care is don't care. Conventional medicine has allowed itself to become a joke, to become an embarrassment, to become a disgrace. Okay, it reminds me of something out of the 1700s where they had only one trick, which was to do a phlebotomy, which can help in some circumstances, but usually doesn't. And so the modern approach is to give drugs. And there are some drugs that are helpful, but the vast majority of them are not. And now, like I said, it can't be improved until it adopts biblical ethics, Bible ethics that say the patient really matters, they're important, and we must do right by them no matter what happens from a financial point of view. Okay? And for example, I knew one hospital in a bad neighborhood in a big city where doctors used to work on a volunteer basis. You know, they signed an agreement that they couldn't be sued, but they were willing to work for free. I would work for free if I knew I couldn't be sued. But the hospital said no. After a couple of years of doing that, they said, nope, you have to accept the risk of being sued. And so all the best doctors in the whole city all enjoyed working for free to help patients and where they weren't under time pressure. But then they said, no, we cannot give you medical legal protection. So they all quit. And the hospital went, down into the garbage can in quality. Okay, Ayn Rand quote, the smallest minority is the individual. Yep, if you pay attention to individual rights, everything else follows from that. And currently we don't. Art is the concretization of metaphysics. Okay, well, that's a little bit getting on a sidetrack, but I'm kind of making the point. If you look at what happened in modern art, in some sense, it reminds me of what's happening in medicine. Okay, and by the way, the greatest books on literature, Ayn Rand's The Romantic Manifesto, The Art of Literature by Arthur Schopenhauer. This book, Art in the Bible, is just Francis Schaeffer said, God's a creator, and we are made in the image of God, therefore we should be creators. And what I'm trying to get at is this point of view leads to good things. Look at all these great art that comes out of the point of view that man is special. Okay, once you go down the path of atheistic Darwinism, look at modern art. It's something a child could do. It's fake. It's used for money laundering. They've got statues of feces in the Modern Art Museum. And what I'm telling you, the same thing is happening in medicine. Now, most people, you think I'm wrong. Look, I was first in my class. I've been a doctor over 30 years. I know medicine backwards and forwards. I come from a family with tons of doctors in it. All day long, I talk to doctors. I have medical students and residents. I teach them. I teach other senior doctors, even fellowship-trained doctors. I teach a lot of doctors. I can tell you, I know exactly what's going on in medicine, and it can't be fixed right now because its ethics are based on atheistic Darwinism, that the patient's just a talking monkey with no rights. Who cares about them? And you end up with the equivalent nonsense of what you see in a modern art museum. This is an insult to mankind. This is not art. This is degradation. Okay? And anyways, that's a big deal. You can't have good, high-quality medicine without the Bible ethics of man is the ultimate measure, and to do right by the individual is what we must do. And what I'm saying is, look at the different mentalities here. Tom Wolfe, the great writer, American writer, said modern office buildings, they look like animal cages, and they always have a statue of a turd in front. And I say, Picasso's a joke, okay? His art stinks. Look at this. This is a piece of crap. A kid could do that. And here's a typical office building. It looks like a giant animal cage and with a statue of a turd in front. You see that a lot, okay? And look at one of these Middle Ages buildings. They can build better buildings back around 1200, okay? Because this was done with love by free men who wanted to create something beautiful and special. And what I'm saying is, it's not just technology. Science is mostly a fake word that just means corporate-funded nonsense. Trust the science. Yeah, right. Scientists are poor people who have to pay their bills like everybody else, and they must obey big money. And big money says, promote our product or your history. So they have to promote the drug or whatever it is they're being told to promote, or they go broke. There's very little true, real science nowadays. Almost all of it's fake. Okay. This was one article about science journals, and it said it was an astonishing 65% failed to show statistical significance on replication, meaning that the majority of studies are not true. Here's one done on drug discovery products, and when they would repeat the studies, they would find 75% of the time the results did not match the article, meaning that 75% of the time, which is the majority of the time, the articles were not true. And if a study shows a drug doesn't work, they'll just, not publish it, okay? Aristotle, a thing cannot be a thing and not be that thing at the same time. Contradictions do not exist, according to Ayn Rand. Whenever you think that you're facing a contradiction, recheck your premises, and you will find that one of them is wrong. Yeah, the reason why the premise is to think that the journal articles are true and reliable. They are not. They're like drug advertisements. It's like if you go to the grocery store and you see a whole bunch of magazines about advice for mutual funds. Do you think that's true information? No. Those are advertisements to get you to buy those things. And it's just like the so-called medical journal is a bunch of advertisements to get people to buy drugs and prescribe drugs. Okay? And that's why I like looking at old papers before all the big money took over the publishing system. And how about this one? In the year 2023, over 10,000 research papers were retracted. That is not a misprint. More than 10,000 research papers were retracted for having either bogus results or bogus methods. That's unbelievable. 10,000 papers. If you go back to the year 2000, it was about 400. So what I'm trying to say is this is basically fraud, okay? It's just a way to promote drugs, to sell drugs, okay? So, the drug dealer on the street corner selling amphetamines isn't that different from the pediatric psychiatrist giving them to kids, okay? Both of them are doing some dirty business, all right? America's so-called greatest university, 37 studies had scientific fraud-related problems, okay? Another Harvard professor who studies dishonesty in research was accused of dishonest falsifying of data. There is a major ethical problem in this country because we've gone to atheistic Darwinism. I'm not saying it would be perfect with Bible-based ethics, but it would be a lot better. As Fyodor Dostoevsky said a long time ago in his great novel, one of the greatest novels ever written, Brothers Karamazov, if there is no God, then everything is permitted, even cannibalism. And I will tell you, that's already happening. People don't know about it, but it is. And this is basically what we're seeing. There's a contest between good and evil's winning. We're heading down the path of things getting worse and worse. And what I think needs to happen if we want things to get better, we have to get back on a good path. You have to love that individual. You say, I will do what is right by this person no matter what. I don't care if we don't make hardly any money. We'll do what's right. So hospitals have to be allowed to have a low budget. At least some of the doctors have to be allowed to do this. Otherwise, you can never get better. There is no computer. There is no artificial intelligence. There is no CAT scan, robotic, laser surgery, BS. Nothing will change this. Unless the patient is a priority and not the money, this cannot be fixed. Okay, I've seen all the fancy new technology coming in over the last 30 years, and it makes things worse. It does not make things better because it's used unethically. Okay, the current atheistic system favors profit over patients. Like I said, coronary artery disease, you teach them the vegan diet, you get $0 to $1,000. You stent them $30K per stent. You open heart, you cabbage them, 120 to 150,000. Okay, you need Bible ethics. Man's created in the image of God. Thou shalt not lie, steal, commit murder. Jesus Christus, additional commandments in the New Testament. Love your neighbor, give them the benefit of the doubt. That what you do to the least of my brethren, you do unto me. Do right by that person. You have to go by that and not just be a conformist. Martin Luther was pissed off. The Pope sent him a papal bill. Martin Luther burned the papal bill. There's a lot of paintings of this. Okay. I took the PDR, Physician's Desk Reference, and the DSM, Diagnostic Statistical Manual of Psychiatry, PDR's pharmacology thing, and cast them into the fire for this BS, this nonsense. Here they are, PDR, and that the vegan monk. Okay, and I got the vegan. This was before I had the haircut, and I got the monk tonsure haircut for a while. I did get the monk costume. All right, and what I'm saying is, to understand plant-based diet is like a Copernican inversion, to go from thinking that the center of the health world is drug, surgery, radiation, which actually leads to health hell, when it's sort of God's way, if you will. Sun, social, love, sleep, laughter. And all this stuff is essentially free because you got to pay for food anyways. So you can imagine a system based on profit. It doesn't want to hear any of this natural God's way. Take that and shove it is how the conventional system feels, okay? And it's also true, a lot of patients, they're cognitively impaired, they're slow, they're drug addicts, they're stupid, whatever it might be, that they're not going to be capable of changing their behavior or their diet. That's fine, but then it's their fault, not the system's fault. And that's actually, I would say, the majority of the patients. But a doctor can at least have the satisfaction of they know the true cause, they know the true treatment, they know the true possibilities. And I actually think it wouldn't change things that much because most patients will not be willing to change their diet or their behavior, but at least it would be the patient's lack of effort, not our ability, not the doctors. But I don't think it'll ever happen because can you imagine if you ran a business and you're making $1 billion a year? Do you think you're going to change something so that you're going to lose money? No. You say, no. We're going to keep doing it the money-making way. And anybody tries to change that, we will, take them to court or fire them or take their medical license away. So I don't think it's ever going to change. So again, like I gave you that story earlier of the rabbit cannot change the forest. All the rabbit can do is learn to deal with it. And so I think that's the case for the individual. Be smart, learn how to take care of your health and avoid all this stuff. Okay, basically you go to the healthcare system, the people at the bottom, the transporters, the clerks, the secretaries, they love the patients. They're probably patients themselves and their family members are patients. The doctors mean well, but they have thin, narrow expertise in their specialty. When you go up to hospital owners, the people who run hospitals, man, they just want to make money. Their job depends on them making money. If they don't make money, they're in trouble, okay? So they have to focus on the profit. And then big pharma, big money, person who might own the hospital or company who might own the hospital chain, all they care about is money. They could care less about the stupid patients. They'll even call them names, useless eaters, wasters of resources. They don't care about them. So anybody who thinks the system cares about them, they're in for a rude awakening. Here's Diogenes walking through the streets of Athens. He was a street philosopher, homeless philosopher with his lantern searching for one honest man, okay? And here's the old joke. What's the difference between a lawyer and a doctor? A lawyer will rob you. A doctor will rob you and kill you. Voltaire said, I want my doctor to believe in God so that he does not rob me. Okay. Voltaire also said, it is dangerous to be right when the established are wrong. To announce truth is an infallible method of being persecuted. I am very fond of truth, but not at all of martyrdom. Voltaire also said, those who can make you believe absurdities can make you commit atrocities. That's very common. Lots of stupid people, lots of conformist doctors and other healthcare workers, they will do exactly whatever they are told, no matter how stupid it is. They will ignore the evidence right in front of their eyes if they are told to do something. They are trained to be conformists and to follow orders, okay? Kind of reminds you of the 1930s. I was just following orders. What kind of BS is that? That's why you should have Bible-based ethics, St. Augustine. Wrong is wrong, even if everyone is doing it. Right is right, even if no one is doing it. Okay, Voltaire has additional quotes that are a little bit relevant. Okay, well, actually, another Voltaire quote I like is that it is difficult to free a fool from the chains he loves. Yeah, lots of people. Oh, I won't stop eating meat, blah, blah, blah. I'm also reminded of the story of St. Francis, the Italian monk who he had a vision that maybe he could save the church. And the Pope had a vision that that some monk could maybe rebuild the church. He saw this broken down church in Siena. And so St. Francis, helped to rebuild the church, rebuild the walls, rebuild the roof. Okay, and he did rebuild the chapel. But what he also did, like in the Pope's point of view, he started the order of the Franciscans named after St. Francis. He also inspired people. And so in a sense, he rebuilt the credibility of the church. And I think the credibility of the conventional medical system is really in the gutter, in the garbage can right now. And one of the ways it could rebuild itself would be to have a nutrition specialty. Tons of colleges are going bankrupt as more education goes online. What I'm saying is they should refurbish some of these colleges and make them into so-called fat camps or nutrition centers and have nutrition health people giving lectures. The patients can stay in the dorms and then they can eat in the cafeterias. They can go for walks around the campus. That would be a great use of these facilities. I would love to see it happen. Okay, and this is an old joke too, kind of going back to the Burkitt days. He says, if the patients eat low-fat vegan diets, all you need is tiny little hospitals, and you can cure more people in a little tiny nutrition clinic than you could in the biggest, most fully equipped modern hospital. And I jokingly drew it as looking like a giant animal cage with a statue of a turd in front. Okay, so basically either we're going to have better ethics or we're going to have crappy healthcare. Who's going to win, the good guys or the bad guys? And the bad guys got the money and the power, and they got an established system. So I kind of doubt it's going to change. But the individuals now, the few that are smart enough and wise enough, can climb out of Plato's cave and get better outcomes for themselves, their family, their friends. And this is what I call, the Spartan vegan diet. I've also called it the medical monk diet. It's real simple. Get most of your calories from starches to satisfy your hungers, but fruits are also quite good. They're actually better than people realize. Eat some veggies for the greens and nitrates, for example. You're probably going to need to take vitamin B12. I like methylcobalamin and PO. get these social aspects of your life squared away reasonably. It'll improve your health. Somebody, one of my viewers, made this for me, the Wise Monk diet. I thought that was kind of cute. Because I started with this monk tonsure haircut with the Martin Luther Medical Reformation book. It's the same pyramid as before. So anyways, oh yeah, atherosclerosis is partly reversible. We don't need to show that. I do show this. So once when you go low-fat vegan diet, you'll often reverse your atherosclerosis to some degree. And sometimes, this is The Raising of Lazarus by Jean Jouvenet, by Jesus Christou. And what I'm saying is sometimes the Johnson will come back to life. Here's the Johnson coming back to life as the atherosclerosis regresses, both the cornea and the atherosclerosis everywhere in the body. And to end our lecture today, I made what I call the impotence prayer. Our Father, who art in boner land, solid wood be thy name. Give us this day our daily boner, and forgive us our dietary sins, as we forgive those who misdiet against us. And lead us not into temptation, but deliver us from impotence. Amen. That's it. You're on mute. I can't hear you.
This is better. Thank you, Dr. Rogers. That was awesome. And if anybody who was watching wanted to purchase your book, this is just a little bit of what is in this over 700-page book. And there's so much as a reference book or to share with your physician. I think it's one of the best books out there about nutrition and how the things that the doctors don't learn in medical school that we really need to learn more about. So I really thank you for that. We have some questions actually that came in, so I'm going to go and look at those. All right, so Ellen, greetings Ellen, said, is stainless steel problematic for health? Catherine Reed mentioned this briefly on Chef AJ.
I don't recall hearing that. I did watch that lecture too, so I might have missed that. I'm not aware of stainless steel being a problem. Usually stainless steel is thought to be the best cookware that you can get. There's some talk about using newer titanium stuff, but it's new, so I don't really know for sure if I trust it or not when something's new. Stainless steel's been around a long time. You don't want to use aluminum. You get aluminum in your food. You don't want to use non-stick stuff because that tends to have what's called PFOA with a lot of fluoride in it, and that tends to be thought to be neurotoxic and bad. As far as I know, stainless steel is the best. If you can remember what they said, now that you mention it, I'll try to, make a note to myself to be aware of it. But no, I wasn't familiar with that.
Okay, thank you. Jay said, is there a reliable test for autism or Asperger's?
Well, I don't specifically know. Autism, you typically think of a child, like a young child having problems with their speech, having problems with their social interaction skills, their behavior. That's usually what you think about with autism. Asperger is sort of considered a separate type where a person might be good at things academically, good at computer programming, for example, but not have very good social skills. So I don't know of a specific test for it, but I can just tell you like Asperger's, I've been accused of having Asperger's, okay, which I don't think I have at all, but I get teased about it for just because I'll be interested in studying. I'll study a prolonged amount of time, okay? Bottom line is I don't know of a specific test.
Okay, thank you. Steve Alley said, what causes celiac disease?
Oh, now celiac disease is a big subject. Some of it, I think, is an autoimmune disease. There's a big guy who writes about this. He's from the Harvard Hospital. Off the top of my head, I think his name, it's like he's an Italian guy, and he wrote entire books on celiac disease and on leaky gut. But being affiliated with the Ivy League school, he's a Harvard pediatric gastroenterologist. I think it's like Anthony Fasano or something like that. He's always going to be pressured to come up with a drug-based treatment for it. So what would I worry about in the context of celiac disease? There's a lot more people gluten sensitive than there used to be. I would be worried about all the GMO food with all the glyphosate sprayed on there. I would be worried about everything that causes leaky gut. And I would avoid all that stuff before I would jump into just trying to eat the non-gluten diets. But I don't have that much knowledge of it. There is some guy who talks more about these things. He's sort of William Butkovitz or something, Butkovitz or something. He wrote a book. Bolsevich, yeah, fiber fueled or something. Mm-hmm. You might check out what he has to say about it. It's sort of not my thing. But as far as being an autoimmune disease, for all autoimmune diseases, I would avoid all the things that cause leaky gut. That tends to be the main cause of them.
Mm-hmm. Very good. And you went over that earlier in the presentation, so that'll be helpful to go back and look at that slide. Okay. John said, what are some practical tips for ensuring a plant-based diet provides all necessary nutrients without supplementation?
Well, I would probably sort of forget about it. And you could say, well, how could I say that? Because what I would do is I would sort of look at what did our ancestors probably do? They ran around all day trying to eat some plant foods. And so all the nutrients are there in the plants. They come where the nutrients come. They come out of the ground. For what it's worth, I've been 100% vegan about 6 years. I was a vegetarian about 20 years before that. Before that, I ate probably, you would call almost like a Mediterranean diet, not intensely. I didn't know any better. My mom's sister had a PhD in nutrition, so I was lucky when I was a kid. They would always put fruits and vegetable snacks on the kitchen table. So we'd run around playing, and we'd always go in the kitchen and eat that. For dinner, we would eat typically things like rice and beans with some chicken in it, and also a little bit of fruits and vegetables. So I think better than most people. And for what it's worth, my family, we were all real strong, great athletes. Okay, one of my brothers is a world champion athlete. So I think those are all benefits. But what I'm saying is they never took any supplements. I think this whole supplementation is mostly bogus and fake. You have to convince people they have a nutrition problem before you can sell them a supplement. So, you try to convince them they're deficient in omega-3s. Well, it turns out plants have plenty of omega-3s and plenty of omega-6s. You don't need a supplement. I'm not aware of any supplement that vegans routinely need other than vitamin B12, typically methylcobalamin. That's the only thing I take is vitamin B12. And for what it's worth, I got all these young people in their 20s, even their 30s. Oh, I have brain fog. I can't concentrate. I have attention deficit. I have anxiety disorder. I'm 60. I have 0 medical problems. I can concentrate 12 hours in a row just fine. And what I'm trying to say is I'm aging better than all the doctors I know my age, because I know lots of them. This is the way to be. I think this whole idea of supplementation is overrated because it's how you make money, by selling people stuff. I think that stuff about older people need more protein or they get sarcopenia weakness, I think that's all BS. All these epidemiologic communities, the older people that didn't take supplements, they exercised, they kept moving. I'm real strong in the weight room. I'm stronger than the young guys who are doing push-ups. I say that because this is kind of the attitude that you have to be fat, weak, and stupid when you're older. It's not true. Like I said, I'm 60. I'm strong. I got great memory. I got great concentration. And then you look at these communities, you got people that are working in their 90s in these low-fat plant-based communities. They're still vigorous and energetic. And they also say, if you read the blue zones and all that stuff about the centenarians, they tend to have an easygoing sense of humor. They kind of take things in stride, make lemonade out of lemons, if you will, have a sense of humor. And they also keep busy. They're all religious. They're all sort of pro-family, traditional values, okay? That leads to a happy, healthy life. Modernism kind of tricks people. Modernism is always trying to tell people, you need to buy our thing, whatever it is. All that old stuff is bogus. Actually, that old stuff sort of accumulated wisdom with time.
John said, I've been whole food plant-based for over a decade. I'm 5'10", 160 pounds. I have pain, sometimes tingling on my feet. B12 normal. Does the extra fat on my body contribute to this pain?
At 5'10", 160, man, you're skinny. You're real skinny. You don't got a lot of fat. So it's not because of the fat. I'm not sure why you have a tingling in your feet. I knew when I went vegetarian, I used to have a tingling in my feet, and it went away. Okay, my back pain went away. I got better blood flow to my tissues. So I don't know what it is. Diabetic neuropathy could be causing a problem, but you're real skinny. So I don't know what your previous past health history was. When you improve blood flow to tissue, you can sometimes cure neuropathy. A lot of diabetic neuropathies have gotten dramatically better when a person optimizes their diet and health. But I don't know what you got. You could have a spine problem, compressing the nerve that goes to your foot. So I don't know what you got. I would consider that. I consider these other things. I would, first of all, optimize diet and blood flow, see if that makes a difference. Let your doctor know.
C said, does abdominal pressure syndrome reverse or recede?
Well, the thing to do is stop promoting it, okay? Lots of us ate the lousy diet when we were younger, low in fiber. But actually, when I was in college and wrestling and stuff, I used to eat tons of cereal because I was by myself. I'm a guy living by myself. I would just have one thing in the fridge was pretty much skim milk. And then I would have boxes after boxes of cereal. I would eat tons of cereal. But anyways, the abdominal pressure go away. You're not going to, let's say you have gallstones. They're not going to go away, but they probably will never cause you any symptoms. That's what you want. you're not going to have your little kidney calcification go away, but it will be much less likely to progress to becoming a full-blown symptomatic stone. And again, you might have a little fecalith in your appendix, but it'll be unlikely to grow and cause appendicitis. So you've got a very good chance to prevent future symptoms, and that's what you want to do.
Okay, thank you. Well, Green Warrior, please click like to show your appreciation for what Dr. Rogers shared with us today. And Dr. Rogers, tell us about what you do and how we can find you on social media.
All right. Well, yeah, basically I'm 60 years old. I used to be an imaging guided surgeon. Now I'm a neuroradiologist, sort of changed to that. There's more work for me. And I like the brain. The brain's more interesting. I kind of miss, though, the social. It's more fun walking around, making rounds, having a bunch of medical students, residents and stuff following me around and, talking to people all day long. And now I do a lot more generating billing codes. Lots of people come to me for nutrition advice. So I help them out just, as for friends for free. Basically, I have a YouTube channel, Peter Rogers, MD, and you're more than welcome to come there. I've got tons of videos, about 1,900. The playlists are probably the most helpful. Like you can type on the playlist for diabetes, for hypertension, for brain disease, for spine disease, for autoimmune, etc. What else? I've written a bunch of books. Like I said, here's some of my books. The Medical Reformation is a big one. I've written a whole bunch of other ones before that, specific books on how to prevent dementia, what a poor man can do to minimize risk of cancer, things like that. So, I hope you find them helpful. I try to answer questions in my YouTube every day. I don't always have time. I still work full-time in conventional medicine because I don't make any money with this nutritional stuff. I wish I could, make a living with it, but I can't. But I sort of feel like my destiny is to try to become the best doctor in the world. I feel like I have the ability to do that because I don't have to play any games. I'm not selling anything, so I don't have to focus on the money. And I notice that the fact that I'm free to just do whatever I think is right. And then, I was really smart in school and I enjoy studying. I think the biggest thing is that I'm perfectly happy to sit all day long reading journal articles, reading books, or trying to understand a medical problem. So that's kind of what I'm doing in my so-called old age. I'm 60, but, that's basically it.
Well, thank you, Dr. Rogers, for your insightful commentary on the challenges within the medical field and the potential of a whole food plant-based lifestyle to revolutionize healthcare. And Dr. Rogers, what's your final take-home message for our Green Warriors?
Well, I'm saying, it's real sad. Terrible things that happen to people that eat meat and oils and processed foods and that aren't aware of any of this toxicology. They have lousy outcomes, and the medical system can't save you from this stuff. So smart move is give yourself a chance. And there it is. We're providing this information for free. You don't get a much better deal than that in life.
So true. Well, Green Warrior, tell us what you're going to remember from today's broadcast. Go ahead, type that in the comments so other people in the future can take a look and see what we were talking about. I also wanted to thank Jess Tasboy. She did the countdown and she did the promos and did so much to help get the word out about this broadcast today. Jess Tasboy, who's coming up next?
Does fear or anxiety prevent you from living your fullest life? At 69, V. Lynn has pieced together the traumas of her life, offering an inspiring message for those still searching for their own awakening. Don't miss this powerful conversation. Join us on Wednesday, June 5th, 3 p.m. Eastern, noon Pacific, on Be Green with Amy Live.
Of course, thank you, Green Warrior, for joining us today. Your engagement and your support make these discussions meaningful and impactful. And I hope you're feeling inspired to take a closer look at your food choices and make some positive changes for your health and well-being. And remember, every bite you take is an opportunity to nourish your body and become the healthiest version of yourself. And please stay tuned for more empowering content. Please subscribe to my channel and to Dr. Rogers' channel and share my message with others who can benefit, because together, as Green Warriors, we can make a meaningful difference in the world. And a special thank you to all of you. I'm offering 5 free recipes for whole food plant-based, SOS free. Just go to my website, begreenwithamy.com/join, and I will send them to you. And if you would like to join me with Dr. Rogers with my tagline, you can surely type it in the comments below as we sign off. Are you ready, Dr. Rogers?
Yep.
Okay. Until I see all of you again, remember, be strong, be well, And be
Be green.
green. Thank you so much, Dr. Rogers. Thank you, Green Warriors.
Looking for really tasty recipes that are SOS free? No sugar, oil, or salt. How can it taste good? Well, if you like flavor, then you'll love this Be Green with Amy recipe ebook. Get your copy today. Click on the link in the show notes. Be strong, be well, and be green.